Okay, we're going to go ahead and get started. Good morning. Welcome to the hearing of the Joint Committee on Children, Families, and Persons with Disabilities on bills relating to the Executive Office of Health and Human Services with a focus on the Department of Transitional Assistance. I'm Senator Robin Kennedy, the Senate Chair of the Joint Committee, and I am joined here today by my House Co-Chair, Representative Jay Livingstone, and we're now calling this meeting to order. I'd like to thank my co-chair, our committee staff, Carl Richardson for making this hearing accessible with CART and ASL interpreters. And I'd like to welcome and thank everyone who's come here to testify today. Today's hearing is hybrid, and bills will be heard in the order that was displayed on the hearing notice, with companion bills heard together. This list is also posted on the sign-up sheet outside of the hearing room for your reference. Please note that the schedule is subject to change and that elected officials may be called out of order at the discretion of the chair. If you signed up to testify prior to this morning, I will call your name in the order it was received with each respective bill. If you signed up to testify just this morning, you will be called after we have gone through each bill, time permitting. Please note that there are several bills on the docket today with many people signed up to testify, and we will limit testimony to 3 minutes per person and 6 minutes for a panel. For those in the room, there'll be a clock on the screen that will count down your time, and I will also let you know when time is up. We ask, and I want to thank everyone that has submitted testimony on several bills prior to the hearing. We'd ask if you don't have a chance to complete your testimony today, or if you'd be willing to do so, to please also submit your testimony in written form to the committee after the hearing. To ensure that everyone has the opportunity to testify, each person is only permitted to testify once through the entirety of the hearing. If you are testifying on multiple bills, we will call you for the first bill on which you will be providing testimony. We ask that you combine your testimony on all bills on which you are testifying to the extent possible. No one will be called up to the rostrum more than once. The first bill will start by calling those that are testifying in person, and then the second bill will start by calling those that are testifying virtually. This will swap back and forth for the entirety of the hearing. If you have any questions or concerns or technical difficulties, Legislative Information Services and our staffs are monitoring the Zoom room and are also located throughout the hearing room to help. I will now turn it over to my co-chair, Representative Livingstone, for his remarks and introduction of the House members.
Thank you. Jay Livingstone, the House Chair, and I'm really excited to be joined by my neighbor, representative who's appearing virtually, John Moran, who was just elected in a special election and has joined the committee. So welcome, Representative Moran, and also joined by Representative Ramos in person. Thank you.
Thank you. So first, I believe Representative Garberly, if you'd like to join us and testify.
Thank you so much, Chair Livingstone and Chair Kennedy. Thank you for taking me out of turn. I know you have a robust agenda, so I will try to keep my comments brief. Also to members of the committee, thank you so much. I'm here to testify on two bills, House 172, hospital training to enhance healthcare for people with autism in IDD, and House Bill 212, filed by my friend Representative Angelo Pupolo, around reconstruction of public buildings to include universal changing tables. So the legislation around hospital training, I filed with my friend Representative Ryan Hamilton and Senator Jason Lewis. A few years ago, in a hospital in the North Shore, a gentleman in his 50s walked into a hospital on the North Shore seeking support. He had autism. The hospital released him prematurely with no plan, no call to his caregivers, and they found him deceased in a snowbank. An absolute tragedy that could have been avoided. I spoke to his mother a couple of days ago, who really wanted to be here, but unfortunately she couldn't be, but she is submitting testimony. And in between her moments of emotion, she articulated to me, how she felt. Obviously devastated. But the fact that a call never came from the hospital to let her know that her son was being discharged, she would have been there. She had no clue. And he died as a result. This is not a bill about punishing hospitals, quite the opposite. This language is embraced by the Mass Hospital Association. This language has been worked on through the several last sessions and trying to get this right with the goal of protecting all patients. Hospital workers work so hard, and they want to know when a patient with autism or IDD comes to their facility so that they can have the best preparation available for treating that individual. We want to avoid circumstances that resulted in the death several years ago of a patient with autism. And I believe that we can do that. So I look forward to really working with this committee to getting the language right, because we want to protect all patients in the Commonwealth and make sure that hospitals are facilities where all individuals can thrive and get the best health care. House Bill 212, filed by Angelo Pupolo, is around universal changing stations. This can be a difficult topic, right? No one wants to talk about changing stations, but it is a real problem for individuals with disabilities, adults with disabilities, and their caregivers. I was at Logan Airport a few weeks ago, and I noticed that they have several areas where dogs can go and use the bathroom. They're kind of green areas, and that's important, right? I have a French bulldog. I care about my dog. But there's no place in Logan Airport where an individual who's caring for an individual with disabilities can use the bathroom. There's no changing station. And they have to use literally the floor. And it's not just at this airport, it's facilities across the Commonwealth. We're just not thinking about inclusiveness and trying to make the lives of those individuals better, where caregivers literally have to go on the floor to change their adult loved one. I think we can do better in Massachusetts. It is true. I think the coalition that's working with the committee is trying to submit language to improve the bill, the language of the bill. We're trying to get this right, but we're trying to create in Massachusetts, we need to be more cognizant of being inclusive and caring for these individuals. So I ask that you consider this bill, and I look forward to the committee's work on the bill. Any partnership I can be in supporting the committee's work, please let me know.
Thank you.
Questions? Thank you so much, Representative. All right, next online, I believe we have Representative Mary Keefe, who'll be testifying on behalf of House Bill 187.
Thank you. Can you hear me? Yes. Okay, great. Thank you, Chair Livingstone and Chair Kennedy, for this opportunity to speak to you and the members of the committee today. I'm here to talk about Bill H187, which has been jointly filed by myself and Rep. Patricia Duffy from Holyoke, and S117 filed by Senator Moore. This legislation presents a simple common sense safeguard against the Department of Transitional Assistance trend of relocating office spaces and services that are convenient for its clientele, as what happened in 2021 in Worcester, relocating their offices and services further out at an inconvenient place for the people in need. So this happens, and I'm sure Senator Kennedy, you remember it well, because I think advocates came together once it was decided that the move was going to happen. And actually what we found out was that the move was in progress. So without any public hearing, public testimony, public reaction, this move happened and very inconveniently took away and moved services to the Millbury town line out of downtown Worcester. What this really did was make it so difficult for people. If you were traveling from, say, Cherry Valley, which is part of Worcester, to this office, you would have to take a bus downtown and then transfer on that bus to travel the other 4 miles out to this office. And we had sat down several times with DTA to talk about the inconvenience of this and the hardship that it was going to cause for many people who don't have vehicles, that rely on public transportation. And their solution was to say, well, we'll put some kiosks downtown, meaning small computer type machines that people could use. And that's the other thing, that people aren't always technically savvy in being able to use these. We know that nothing can take the place of a person-to-person connection, especially when you're in a place of need and you are looking for assistance. So you're going to hear from other people today about this bill. What it would do would require the Department of Transitional Assistance to hold a hearing anytime there is a change in location, and that the advisory committee, which each of the community service areas have, would be able to get advance notice to this plan to move or proposal to move. And in closing, I just want to say it's a way for us to understand and to have a voice around these decisions around government services and providing through the state to the community. Downtown Worcester, if you came down to the DTA office, you could have your 2 kids in tow and access a number of services in the same morning or day. So you would be able to go to City Hall if you needed records. You could go to our CAP agency and look for fuel assistance. You could go to the Family Resource Center. Everything was very connected and easy to access. And so DTA and moving out to the outskirts of Worcester really broke that that connectivity. And so we want to safeguard against that. And that's what this bill is about. Glad to answer any questions. And we'll be submitting, Rep. Duffy and I will be submitting written testimony as well.
Thank you, Representative Keefe. Any questions from the committee? Great, thank you. Next, we have Senator Mike Moore, who is also online to testify on behalf of H187. Senator Moore.
Thank you, Senator Kennedy. Can you hear me okay?
Yes.
Okay, thank you. So good morning, Chair Kennedy and Chair Livingstone and members of the committee. Thank you for taking me out of order today. I am here to speak today in support of Senate 117, an act protecting safety net access for Massachusetts residents. The House version of the bill, which is House 187, was filed by my colleague in Worcester, who you just heard from, Representative Mary Keefe. This bill deals with the Commonwealth social support programs and how they are accessed by the populations that need them most. What resources we provide and how we fund them is a complex and ongoing conversation. However, one aspect that is often undervalued is how those services are assessed. While there are basic standards, including compliance with the Americans with Disabilities Act, so many other factors can impact the ability of families to use these benefits. In early of March 2020, the Worcester office of the Department of Transitional Assistance moved the locations to a new location on the south side of the city of Worcester. Although the office would soon assume its physical office due to the COVID-19 pandemic, the repercussions of that move would be felt soon after the reopening. Prior to the move, the office was located in downtown Worcester, a central location for the city's region's residents and easily accessible by many forms of public transportation. The move provided some much needed new space, additional parking for employees and customers, as well as an improved relationship with the new landlord. However, the new location also offered significant challenges for many of the clients who rely on the office. Firstly, it was a significantly further distance from the economic hub of downtown Worcester and far more difficult to access by public transportation. In fact, the WRTA bus route had to be extended in order and adjusted in order to reach the new office at all. This caused enormous difficulties for the exact type of clients that are most often served by DTA: single parents, families with children, and those without personal transportation were forced to drastically alter their schedules and routines to accommodate the longer trips caused by the move. Following a number of complaints through our offices, Representative Keith and I, and along with local advocates and leaders, engaged in or with the Department of Capital Asset Management and Maintenance about the process they use to site the new office. While there was little to be done in the short term with a lease already signed and operations on the move, we noticed the lack of community participation in the process that could have spotlighted these challenges. As a result, we have filed this legislation that would promote the use of true public process that takes into account transportation times, often office hours, access for seniors, families, and people with disabilities. While the timeline of such moves are difficult to project due to the nature of DCAM's leasing process, it is clear to us that more public participation will enhance the ability of these offices to serve the vulnerable populations that they are intended to serve. So I ask that the committee support our effort and to expand public participation in this process, and ask that you move this bill forward with a favorable recommendation. And I'm more than happy to answer any questions.
Thank you, Senator Moore. Are there any questions? Great, thank you.
Thank you.
We've also been joined today by Representative Doherty. Thank you.
Thank you. Representative Sousa, we welcome you to testify.
What's that?
Thank you so much to the chairs and to the committee for hearing me out of turn. I'm here to testify on House Bill 221, an act increasing collaboration among community organizations fighting hunger. In a community like Framingham, I represent the 6th Middlesex District. We are very blessed to be rich in community partners. But one of the issues that happens is that very often we have replication of services. We have, for example, 3 organizations dealing with food insecurity. For example, saying they feed 500 people or 500 families in a week. Well, there's no mechanism right now to identify whether or not they're feeding the same 500 people. And while I wish that was the biggest concern that frankly keeps me up at night, it's not that we are having 500 families possibly fed. And that's just an example, multiple times or through multiple organizations. It's the other families that are falling through the crack because organizations are replicating services and don't have the data to go seek out additional families that need help. And with that bigger issue, we've noticed this especially with the influx of refugee families that have come to many of our communities now. It's been hard in dealing with food insecurity. When there's no communication, there's no collaboration, there's no mechanism to share data. So what this bill seeks to do is to start the conversation and increase the space for collaboration in order to have more effective community partners. Thank you so much.
Thank you, Representative. Any questions from the committee?
Sorry, been a minute.
Excellent. No questions. Thank you so much.
Thank you.
Okay, so the next, we're going to start with House Bill 135 and Senate Bill 76, an act establishing basic needs assistance for Massachusetts immigrant residents. I want to apologize before we begin, apologize in advance if I mispronounce any names, and I certainly welcome correction when you introduce yourself to testify. We'll begin with the individuals who have signed up who are in person for this bill. And first I have Palma McLaughlin, who I understand will also be testifying on behalf of House Bill 144 and Senate Bill 75. Palma, are you here? Okay. We will return to people that aren't present now at the end of after we've heard testimony from everyone here. Next, I have a panel of with Gladys Vega and Pat Baker. Welcome.
Buenos días. Good morning. My name is Gladys Vega, Executive Director of La Colaborativa. Love the location, beautiful work. So congratulations to all. I am here today as a person that began during the pandemic a food pantry out of the porch of my house. I am that person that was feeding 11,000 people once a week in our office. And I created a food pantry in the office after I did the work recruiting food and donations and stuff. And let me tell you, our situation has not changed. Our lines, I still have a food pantry underneath the, not the Tobin Bridge, but the overpath of the continuation of the Tobin Bridge. And I feed 7,000 people twice a week. Many of our community members that we feed are from many cities in the Commonwealth. They're immigrants with legal status. Some of them are dreamers. Some of them are people that are waiting for their 5-year wait for their residents to become naturalized citizen. And I have a lot of people that have an opportunity. They work, they were working okay. They got their hours cut. They were working in the local bodegas, restaurants, and now the income has not been able to be maintained because they cut their hours, or even if they have full-time hours, they're paying amazing amount, like huge amount of rental, renting apartments is a high cost, utilities a high cost. I am here today to urge you to support House Bill number 135 and Senate Bill 876. I tell you, at times, we run out of food at the food pantry. We have such a need. I myself, when I go shopping, I noticed that in 3 bags is $150. Utility has gone up. So for me, feeding immigrants in Massachusetts, in the Commonwealth, that have legal status is extremely important. Sometimes I was that young girl that my mom was a substance abuse and alcoholic when I was very young. I was that child that had to go to school for breakfast and lunch, because if not, going home, I didn't know what I had. That is the reality of many of our kids in the school system. So having cash assistance, food stamps, a support like that, when they were the first responders and they were the ones working long hours during the pandemic and continue to do that, but the money, the economic crisis is impacting them drastically, and we need your support to pass this legislation that was extremely helpful in 1996 when Senator Cabral passed it. So please Keep in mind the needs of our community. Keep in mind that a healthy community is a community that has a housing and food in their table to feed their children. Gracias.
Good morning. I'm Pat Baker, Mass Law Reform Institute, in support of House 135 and Senate 76, an act to establish basic assistance for Massachusetts immigrants. We have a broken immigration system right now. We know that people who are legally present are waiting for work authorization for months. We join with the Healy administration in urging support of getting the Biden administration to expedite the work authorization. At the same time, we have an incredibly complex system or patchwork of federal rules of who is eligible for federal benefits based on their immigration status. For example, nationals of Cuba and Haiti qualify for federal benefits, federal cash, refugee cash assistance, and food stamp benefits. They have humanitarian parole or pending asylum. And yet nationals of Venezuela, Nicaragua, Colombia cannot get those benefits, even though they have the exact same status. This is a crazy patchwork of eligibility. We have Ukrainians who currently are eligible for benefits with parole, but if they lose that parole and get something called temporary protected status, they will lose their benefits. That's the specter we face in Massachusetts and across the nation. Victims of violence who have U visas, cooperating with law enforcement, they too cannot get benefits. You will hear from a victim of violence today about her plight. Battered immigrants, legal permanent residents have to wait 5 years to get the benefits. How did we get here? Well, 27 years ago, I had the honor of working with Chairman Cabral to get this legislature to approve state-funded benefits for legally present immigrants. And Speaker Finneran agreed with, and we carried that benefit on for 5 years. We don't have those benefits now. We have faced this crisis because of COVID. We have seen what's happened in the Commonwealth when we don't have the resources. We have essential workers with work authorization who cannot support their families. They do not make enough and they cannot get SNAP benefits. These are the families that are at La Colaborativa's food pantry near the Tobin Bridge. This bill would provide state-funded access to core basic benefits, food benefits, and for a small subset of families, cash assistance, because many families don't apply for cash due to fear of public charge. This bill will help families get on their feet, and it will help families in shelter who do not have access to benefits to move out more quickly. We strongly urge the committee to support quick and favorable reporting of this bill. I'm happy to answer any questions about the very complex immigration rules and benefit eligibility for this population. Thank you.
Thank you both. Any questions from the committee? Okay. Thank you so much.
Thank you.
Also, we've been joined by Representative Mendez. Welcome.
Next, I would like to call up Senator Eldridge, who I understand will be part of a panel with Rick Glassman and Barbara L'Italian, who will be online.
Good morning. Thank you so much to Chairwoman Kennedy and Chairman Livingstone and members of the Joint Committee on Children, Families, and Persons with Disabilities. Very proud to be here with Rick Glassman from the Disabilities Law Center, and as you had said, Chairwoman Kennedy, Barbara L'Italian, the Executive Director of the Center and former State Senator. I'm here to urge you to favorably report out a bill, Senate 2434, an act establishing a designation of a state protection and advocacy system. And I really want to underscore that many decades ago, the federal government designated the Disability Law Center with the very special charge to overlook essentially most areas where people with disabilities are treated or cared for or perhaps live, but there are a few gaps. And so that's what this bill is looking to do, is fill some of those gaps. Very proud to file this bill with Representative Christine Barber, which is House 3870. Ultimately, this bill is about promoting the rights of people with disabilities. People with disabilities, both visible and indivisible, contribute significantly to our communities. They are our colleagues, families, and friends. The Disability Law Center has served as the state's moral compass for disability rights. I've worked particularly closely with the center on going into state prisons, including the Bridgewater State Hospital, to better serve people with disabilities. So I've really seen the power of the center. Of course, the DLC ensures that our state government scrupulously adheres to the laws that the legislature has enacted to protect people with disabilities. And what this bill would do is expand the Disability Law Center's authority in three critical ways. First, it grants authority for the Disability Law Center to inspect areas of facilities that are not occupied by persons with disabilities, but obviously often can house someone with a disability. Second, it grants the Disability Law Center the authority to access information about patients who are stuck in inappropriate settings. Critically, this includes patients who should be discharged from psychiatric hospitals to community care, clearly a real challenge that the state is facing. And third, it grants the DLC access to death reports from state agencies. So this information will help the Disability Law Center better fulfill its responsibilities. Really appreciate the committee taking me out of turn and allowing to come before with some panelists. Thank you so much.
Good morning. I'm Rick Glassman. I'm the Director of Advocacy at the Disability Law Center, speaking in support of House 3870 and Senate 2434. Our thanks to Senator Eldridge and to Representative Barber for sponsoring this legislation. As Senator Eldridge just explained, it does create basically a parallel scheme. And one thing we have learned in the past decade or so is that sometimes having systems that are parallel provides more protection to citizens of the Commonwealth if the federal government's position shifts from one time or another. But specifically, beyond creating a parallel scheme, as Senator Eldridge says, there are three aspects in which this strengthens rights beyond the existing federal scheme. And I'll just talk a little bit about them very briefly. The first that Senator Eldridge mentioned is to access areas where health and safety is implicated, but people with disabilities who are in that setting may not be able to have access. So we saw this problem of mold at Bridgewater State Hospital. We had mold inspectors going, and it took an act from this body to provide us authority to be able to get into the areas where that mold existed. I'll tell you another example. I had a conversation recently about a nursing home we are investigating where there are deplorable conditions, and an investigator I supervised who found this mouse sitting in a glue trap right by somebody's bed. And so in that situation, we would want to go into the kitchen, the commercial kitchen, and see if there's other mouse traps there, so we could at least notify a health inspector. But we can't go into a place like that. So this change would fix that. The second issue of people who are discharge ready, this has enormous human rights implications if you're discharge ready and you're confined unnecessarily in a hospital, and it consumes a great deal of the Commonwealth's money, and it backs up the whole system because people get back all the way to emergency departments who can't get into acute facilities, who can't get into state hospitals because beds are taken up unnecessarily. And then the last issue about death reports, we already do have access to death reports in many situations, but it's uneven. It may require a probable cause determination. This smooths things out and deepens our access. And I think you'll be hearing later on from a family member of an individual about whom we did a death report. And there are two citations in the written testimony we submitted that give you an example of that important work and how important it is to tell the story of these tragedies so they don't repeat themselves. So with that, I'll thank you and happy to take any questions.
Thank you. I'm going to jump in just to mention in terms of allowing us to monitor within and inspect. You'll be hearing later this afternoon from a Dignity Alliance member who's an accreditor of nursing homes who just can't even believe that we're not able to take a look at everywhere within an institution, as evidenced by the presence of mice in the nursing home that Rick talked about. We will have other folks talking about the need for these discharge ready lists from both MAMH and someone from the peer community as well. And lastly, I will put a name because she is going to step up to the issue around death reports and the need for us to have these from DPH, DDS, and other state agencies. Beverly Goodrich was brave enough to share her story about her brother, Haywood Earl, a couple of months ago, made the rounds in the Boston news cycle. That gentleman in Shattuck Hospital went from a skin cancer lesion on his face that was untreated that ended up becoming metastatic cancer, and he succumbed to it. We would not have found out about that had Beverly not stepped forward. DPH did not share that death report, so it's critically important that we're able to go in, as Rick said, and be able to investigate death reports to see where things have gone wrong, how we can make them better. There were some changes made at the Shattuck, but it's, illustrative of why we need to be seeing these death reports on a regular basis. Thank you.
Great, thank you. Any questions from the committee? Thank you so much.
So much.
Appreciate it.
Next, we'll welcome Representative Cabral, who's online to speak on House 135.
You're on mute, Representative Cabral. Representative, you need to unmute.
Okay, I think I'm muted.
Thank you.
Mhm. Okay. Well, we'll welcome Representative Cabral when he rejoins us online. Next, we're gonna have Representative Dom testify on behalf of House 149.
Good morning. I don't see myself and I'm hoping you can hear me.
We can, yes, thank you.
Okay, I'm here, so I'm happy to put my camera on if that's something that you would prefer, and if not, whatever's best for you. Oh, there we go.
You can go right ahead. We can hear you.
Okay, great. Thank you so much. And I'm actually here to speak on 149 and 150. Would that be all right? I'll stay within the time period.
Yes, thank you.
Okay, thank you. Good morning, Chair Livingstone and Chair Kennedy, and members of the committee. I will be submitting written comments in support of several bills before you today, but wanted just to briefly speak about 149 and 150. But you should expect to see written testimony on those as well as H 144 as well. Your roster of bills today represents our best efforts and response to struggling families in the Commonwealth, and I'm so grateful for your attention and consideration to them. I want to thank the committee for the previous favorable action on both 149 and 150 in prior sessions to advance these bills, and my testimony today will respectfully request that you also favorably act on them in this session. I'm proud to file H 149, which would create a diaper benefit pilot program with Representative Pignatelli and Senator Lovely. It represents our growing awareness in the Commonwealth that diapers are a basic need and that almost half of families struggle to afford an adequate supply of them. This results not only in trade-offs that pit affording diapers against affording food or rent, a choice no parent should ever have to make. The pilot program proposed in the bill is one remedy to address this. You'll hear today from community organizations, pediatricians, and parents and advocates as to the state of diaper need in our Commonwealth. You'll also hear about the consequences of diaper need. What happens when people don't have sufficient supply, since they can't use SNAP or WIC to purchase them. Often babies get exposed to health risks because their diapers are not able to be changed as frequently as needed. Parents suffer because they want to do better. They want to care for their child, and parents often aren't able to go to school or work because they don't have the resources to provide the additional supply of diapers that many childcare programs require. In addition to that, parents suffer embarrassment, shame, and trauma. So I appreciate your consideration. A brief few words on the HIP program, H 150. This bill basically codifies this important food security program into the Mass General Law, a program that as a legislature we have funded in recent years. And that funding has seen that this program is not only effective in increasing food security, but it's effective in bringing access to healthy food to people who otherwise would not have it. And it supports our farming communities. Today, you'll hear from farmers, recipients, physicians, and others about the importance of this program in increasing food security and enhancing our food system. It takes basically increased access to food and increased use and connects them by, in fact, providing people with the resources through their SNAP benefits to be able to access this healthy food. HIP participation, I just want to point out, also reaffirms that when people are provided with the resources to buy healthy food, they eat healthy food. It's not by choice that a lot of people are choosing to steer away from these resources, this food. It's because they don't have the resources to be able to afford it. If I may, I'd like to read briefly a letter I received from a constituent who's a physician in the Springfield area, but lives in my district, where she wrote, I work as a physician in a low-income community and have had 4 people burst into tears this week alone when I asked about household food insecurity. People are very worried about the decrease in SNAP payments and are desperate for help. I am so grateful that I can explain HIP benefits and where to use them so they can support their families. It's a vital part of the landscape of food assistance for Massachusetts residents. Please keep it, expand it, and put it into statute. This program is successful, and in order to increase its success as well as effectiveness, making it reliable, stable program in the Mass General Law would be incredibly helpful and useful. I thank you so much for your consideration, and I respectfully request that both bills be advanced favorably. I'm happy to answer questions, and I will also be submitting written testimony.
Thank you, Representative. Any questions? Go ahead. That makes sense.
It's always the tricky part, turning on the microphone. You'd think that during the pandemic, we would have learned to turn on and off the microphone. Thank you very much, Representative Dome. I know how passionate you are about the issue of diapers, particularly in the pandemic environment. I believe that you have organized diaper drives here in the legislature among us, and certainly in other places in your community. So I am just a question, and you may have addressed it. The audio is a little bit sketchy about how one would determine once the applications have been granted, the money has been granted to the various organizations that would be eligible to receive a grant from the Commonwealth. Are we discriminating about who it is? What is the criteria really that would be required for individual families to apply to these organizations for diapers?
It's such a great question. Thank you, Rep. There is no specific criteria outlined in this bill, but the organizations, can you hear me okay? Yes, okay. The recipient organizations are organizations that already meet the, for example, the food needs of individuals and families. So it would be WIC programs, food pantries, who already set their own criteria and eligibility. Any individual that's already getting services from these programs would be eligible based on the age of their child, essentially. So the only criteria that I could see being sort of put on a consistent basis across the state to maximize the use of resources is the age of children that would be able to benefit, but not necessarily other kinds of requirements. So for example, the Amherst Survival Center, which is an organization I'm very familiar with in my community, asks people to sign up for food pantry purposes. And their one requirement is that they live within a certain community and that they, in fact, need food. That's it. There's no other sort of barriers to them accessing it. Those same individuals are also able to access diapers if they have babies and kids under a certain age, and they would continue to be able to do so if that organization was to receive a grant. I hope that answered your question.
Yes, thank you. Thank you very much.
Thank you. Thank you, Representative Dome.
May I say one other thing? Parents don't want to admit, right, that they can't afford to diaper their babies. And so making it an extremely low threshold program where people can just come and access it is critically important to, in fact, increasing comfort in using it. Thank you.
Thank you.
Thank you. Other representatives of the committee members have joined us online, Rep. Sullivan Almeida and Rep. Sicola, and then in person, Rep. LaBouffe. Thank you.
Great, thank you. So we're going to turn back to our in-person panel. Up next, we have Dr. Pierre and Rich Sherwood. Welcome.
Good morning. Thank you for the opportunity to testify in support of Bills H-135, S-76, an act establishing basic needs assistance in Massachusetts immigrant residents. I'm Claire Cecile Pierre. I'm the Vice President of Community Health Programs at Mass General Brigham. As an immigrant and a physician in the Commonwealth, I understand the intimate relationship between access to food and one's overall health. I have personally and professionally witnessed the difficult decisions immigrants make between food and medical care, often choosing food to survive by prioritizing that for their children and loved ones. As we do our best to treat immigrants who bravely risk their lives to come to this country, I remain heartbroken by the number of my colleagues who still report seeing kids who are malnourished or people who skip doses of their medications because they didn't have access to food. For our patients, it is a painful existence. For our committed physicians, social workers, nurses, community health workers, it is an emotionally distressing experience. This legislation will restore access to basic nutrition and benefits for immigrants in need, providing them with life-sustaining services. And I urge the Massachusetts legislature to support this bill. Thank you.
Chair Kennedy, Chair Livingstone, and distinguished members of the committee, thank you for the opportunity to testify on behalf of Children's Health Watch. My name is Richard Schuert. I'm the Director of System Implementation Strategies, and I'm here in strong support of House Bill 135, Senate Bill 76. We're in our 25th year of operation at Children's Health Watch. We interview caregivers of very young children on the front lines of pediatric care. We're headquartered at Boston Medical Center, and over 25 years, we've interviewed over 80,000 families. We've analyzed data from those interviews to determine the impact of public policies on the health and development of very young children and their families' well-being. So from the vantage point of pediatricians, public health researchers, and child health policy experts, I speak in support of restoring state-funded benefits to more than 13,000 legally present immigrants currently left out of the SNAP and TAFDC programs. We know that access to basic needs, including food, housing, utilities, and healthcare, is critical for the healthy development of young children, as well as their parents' mental and physical health. Compared to children of US-born parents, we know that children of immigrants are more likely to experience food insecurity, live in poor health, and that's increased for those who are more recently arrived. In part, this is because even when these families are eligible, they're not able to access the supports they need. When parents' low wages are not enough to pay for these necessities, or work is hard to find or not medically advised, safety net programs such as SNAP and TAFDC offer partial protection against the material hardships and their health consequences. There's decades of research by my colleagues and others that show that SNAP effectively improves child and family health and reduces healthcare costs. Similarly, research shows that providing TAFDC to families improves children's health outcomes, setting them up for future success. Following the 1996 federal welfare reform, our research at Children's Health Watch found that terminating or reducing cash assistance benefits was associated with increased child hospitalizations, maternal depression, and food insecurity. That's why excluding lawfully present immigrant families from food and cash assistance exacerbates longstanding inequities and challenges experienced by these communities. This bill would allow the state to provide for its immigrant community members when the federal safety net has failed them. It would cost only $18 million and reduce health disparities and inequities across our state. It would likely pay for itself and then some with healthcare cost savings alone. But this is not a question of economics. It's frankly a question of medical necessity and public health. Ensuring that everyone in our communities can meet their basic needs ensures the fundamental building blocks of a healthy and prosperous Commonwealth. I urge the committee to report favorably on this bill and restore basic needs assistance for Massachusetts immigrant households. We're happy to take any questions from the committee.
Thank you. Any questions? No, thank you so much.
Also, we've been joined by the ranking Republican member of the committee, Donnie Barthew.
Thank you. Next, we have a panel of two individuals from La Collaborativa. We don't have names of two individuals. Buenos dias. Welcome.
Good morning, and thank you for this opportunity. I'll simply be translating for them.
Buenos días para cada uno de ustedes. Me siento muy afortunada de estar aquí, conocerles.
Good morning to all of you. I feel very fortunate to be able to meet you all this morning.
Mi nombre es Katie Figueroa, soy hondureña, residente de Chelsea.
I am Katie Figueroa. I am Honduran and residing in Chelsea.
En esta hermosa mañana quiero compartir mi historia con ustedes, como muchos otros inmigrantes en mi comunidad. Estoy siguiendo meticulosamente todas las pautas necesarias para tener una visa U.
This morning, I want to share my story with you all, the story of many in my community. I am diligently following all the necessary guidelines to obtain a U visa due to a very sensitive crime that I was impacted by.
Debido a un crimen muy delicado que afectó por completo mi vida y traumatizó, el cual no me siento cómoda compartirlo. Sin embargo, me enfrento a un desafío inmenso. No tengo acceso a servicios esenciales como cupones de comida debido a mi estatus migratorio.
This crime affected my family and traumatized my family tremendously, which I don't feel comfortable sharing in detail. However, I face an immense challenge. I do not have access to essential services like food stamps due to my immigration status, which is in the process of a U visa.
No tengo pues acceso a cupones de alimentos según a mi estatus en proceso de regularización. Lo que complica aún más mi situación es mi diagnóstico médico. Tengo un aneurisma cerebral que me ha dejado incapacitada para trabajar.
What complicates my situation even more is a medical diagnosis I just received. I have a cerebral aneurysm that has left me unable to work.
Esta condición me obliga a depender completamente de los ingresos de mi esposo para mantener a nuestra familia.
This forces me to rely solely on my husband to support my family.
Tenemos 3 niños de 15, 11 y 5 años que alimentar, y la lucha por llegar al fin de este mes se ha vuelto una realidad desgarradora para nuestra familia.
We have 3 beautiful children, 15, 11, and 5 that we have to feed and house, and the struggle to make ends meet has become a nightmare.
Me veo en la dolorosa situación de tener que decidir entre comprar alimentos o satisfacer nuestras necesidades básicas para poder poner comida en la mesa.
I'm constantly torn between decisions of having to choose between buying food for my family or meeting the other basic needs in my households.
me veo obligada a formarme en largas filas todos los miércoles en la despensa de alimentos de la colaborativa.
I have no choice but to stand in very long lines at the food pantry the collaborative runs every Wednesday,
Que brinda ayuda a quienes lo necesitamos desesperadamente.
that is able to provide much needed assistance to those of us who are in desperate need of food.
Pero la esperanza está en el horizonte, en la forma de la legislación 135 S76.
But I know there is hope in the horizon through this legislation H135 S76.
Si esta ley se aprueba, proporcionaría a inmigrantes como yo acceso a EBT,
If this legislation were to be approved, it would provide legally present immigrants such as myself access to EBT,
lo que significaría un alivio para mi familia y para muchas otras que están en la misma situación de la aprobación de esta ley.
which would mean a huge significant relief for my family, but also for many other families that are in the same situation.
Esta ley no solo mejoraría mi calidad de vida, sino que también aliviaría la carga de miles de personas en situaciones similares.
This would alleviate the challenges and the struggles of many families, not just mine.
Junto con otras voces en mi comunidad, insto a la aprobación de esta ley.
Along with other voices in my community, I urge the approval of this law as an act of compassion and support.
Como un acto de compasión y apoyo para aquellos que estamos luchando por un futuro mejor en Estados Unidos.
For those who are striving for a better future in the United States.
Mientras enfrentamos dificultades económicas abrumadoras, la decisión de aprobar esta legislación
While we're facing overwhelming economic challenges, the decision to pass this legislation
tienen el poder de transformar vidas y brindar esperanza.
has the power to transform lives and provide hope.
Aquellos que como yo estamos comprometidos en el proceso de regularizar nuestro estatus migratorio.
For those of us like me who are committed to following the procedure of immigration for all the immigration status while struggling to survive in this country.
Mientras luchamos para sobrevivir en un país que ahora llamamos hogar.
In a country that we now call home.
Por favor, apoyen la legislación I-35 S76 para que podamos construir un futuro más brillante para nuestras familias y nuestra comunidad.
Please support legislation H135 S76 so that we can build a brighter future for our families and our community. Thank you.
Agradezco por haberme escuchado. Es primera vez que plasmo mis memorias porque debido a mi condición tengo que escribir todo lo que está en mi mente. Y Dios les bendiga por todo.
Appreciate profoundly the opportunity to speak with you all. It's my first time sharing my experience because of my condition, everything I had to write down in order to be able to share. And thank you and God bless you.
Hi, everyone. Otra historia que queremos compartir es una historia desgarradora que subraya la urgente necesidad de aprobar una regularización para brindar el apoyo a familias que han solicitado el asilo político en nuestro país.
Hello, everyone. Another story we want to share is a heartbreaking story that highlights the urgent need to pass this legislation to provide support to families who have requested political asylum in our country.
Como la familia Sukasaka de Perú.
Like the family Sukasaka from Peru.
Su historia es una lucha constante por la supervivencia.
Their story is a constant fight for survival.
Con 3 hijos de 13, 7 y 5 años, los padres de la familia Sukasaka están al borde de ser abismados.
With 3 children, 13, 7, and 5, the working parents of the Sukasaka family are on the verge of being overwhelmed.
Su lucha es mantener a su familia viva y libre de peligro y las amenazas que están recibiendo constantemente, fue la razón por la cual hicieron la difícil decisión de tener que irse de su bello país.
Their struggle to keep their family alive and free from danger and the threats they were constantly receiving was the reason why they made the difficult decision to have to leave their beautiful country.
Pero al llegar a los Estados Unidos pronto se dieron cuenta que sus luchas no terminarían aquí.
But upon arriving in the US, they soon realized that their struggles were not ending here.
La falta de recursos los ha dejado sin hogar en una ocasión en medio de la noche en pleno invierno.
The lack of resources has left them homeless on one occasion in the middle of the night in the middle of winter.
La mitad de una habitación compartida con otra familia fue su única opción a un costo de $750 al mes.
Their only option was half of a room that was shared with another family at the cost of $750 a month.
La economía del hogar los ha presionado implacablemente y proporcionar una alimentación adecuada a sus hijos es una lucha diaria.
The household finances have put this family relentlessly in pressure of providing adequate food for their children on a daily struggle.
Los alimentos son prohibitivamente caros y su capacidad para brindar una nutrición adecuada está en juego.
Food is extremely expensive and its ability to provide adequate nutrition is at stake.
El apoyo de las estampillas de comida podría ser su única esperanza.
Food stamps could be their only hope.
Esta regulación es esencial para aliviar su sufrimiento y garantizar que sus hijos tengan al menos una comida decente al día.
This legislation is essential to alleviate their suffering and ensure that their children have at least one decent meal a day.
Encarecidamente solicitamos la aprobación de esta regulación y cambiar el destino de familias como la familia de Perú.
We respectfully request the approval of this regulation and change the destiny of families like that of the Sukasaka.
Thank you.
Thank you.
Gracias. Thank you both for taking the time to share your stories with us. Much appreciated. And thank you for providing translation. Any questions from the committee? No worries. I think we don't have any questions, so gracias. Thank you. Okay, we're gonna welcome Representative Cabral to continue his testimony. Thank you.
Good morning, Madam Chair, Mr. Chairman, members of the committee. Sorry for the technical issues I've been having this morning, but I really appreciate being taken out of turn. I'm here to testify in support of Bill H-135, an act establishing basic needs assistance for Massachusetts immigrant residents. In recent years, the Massachusetts legislature has shown tremendous leadership in both addressing food insecurity and welcoming and providing emergency shelter for newly arriving homeless immigrant families. The Commonwealth has been at the forefront of welcoming and supporting these new arrivals with dignity and compassion. However, thousands of legally present immigrants remain ineligible for federal SNAP and cash assistance benefits due to a harsh eligibility restrictions put in effect since 1996-97. Massachusetts has provided state-funded nutrition and cash assistance benefits in the past from 1997 to 2002, when the legislature unanimously voted to provide key benefits in 1996 as part of the welfare reform law. The U.S. federal government eliminated core food and cash assistance benefits to thousands of legally present immigrants. In response to this decision, in '97, I led the effort in Massachusetts, backed by all of my colleagues, including then Speaker Finneran and the present Speaker Ron Mariano, to authorize basic cash and food assistance for these immigrants, so they could continue to be productive and active members of our community. Massachusetts successfully filled in this gap in our social service network until former Governor Mitt Romney revoked the program in 2002. It wasn't a good decision then, and it is even worse policy now in light of the pressures that the pandemic exposed. H-135 is our effort to bring this category of Massachusetts residents back into the fold. This will restore basic nutrition and cash benefits for low-income, legally present individuals and families in Massachusetts. The bottom line is this: no child or essential worker in Massachusetts should go hungry. 6 states currently provide state-funded benefits, including California, Connecticut, Illinois, Maine, Montana, and the state of Washington. Massachusetts continues to be a leader on addressing food insecurity and treating immigrant families with dignity and respect. So today, I'm asking you to report favorably H135, so we can join other states in returning to how we once ran SNAP and TFTC by making immigrants with legal status eligible for food aid and cash benefits. Thank you again for taking me out of turn.
Thank you, Representative. Any questions? No. Thank you so much. Returning to in-person testimony, Alexandra Weber.
Thank you, representatives. I'm here to testify on House Bill 135, and I'd also like to share briefly support for House Bill 197. My name is Alexandra Weber, and I'm the Senior Vice President of the International Institute of New England, a refugee and immigrant service provider supporting 8,000 immigrants in Massachusetts this year alone. Every day at IINE, we see the human cost of our broken federal immigration policies and their inequitable treatment of those legally present and seeking safety in the US. An Afghan family may receive 36 months of food, housing, language, and employment support. An unaccompanied Guatemalan child reuniting with her mother may live with hunger and be forced as a minor to work in order to eat. I'm also a social worker, and when I was providing direct service, I worked with Marie, an asylum seeker from Haiti. Marie was referred to me because she was having terrible nightmares about the violence she suffered in Haiti and the grief she felt in leaving her children behind when she was forced to flee to save her life. As an asylum seeker, Marie was ineligible for food and basic assistance and was living at the mercy of a roommate who offered her a couch in her apartment and 1 meal a day in exchange for 12 hours of labor. Marie was a mother seeking a better life, and what she found in Massachusetts was hunger, exploitation, and pain. Every day, IINE helps newly arrived families apply for food stamps, cash assistance, medical benefits, and other support to get them on their feet while they adjust to our communities and seek jobs in our workforce. But while some immigrant families are eligible for our services, others are not, though they have the similar needs. I urge you to pass an act establishing basic needs assistance so that more of our vulnerable communities members, our children and our mothers can receive the most basic humanitarian support. While I'm before you and on the topic of immigrant integration, I would also like to urge you to consider House Bill 197, an act creating a special commission to study the current refugee resettlement infrastructure sponsored by Senators Kennedy and LaBeouf. There are significant gaps in this state's refugee and immigrant integration infrastructure, which have been highlighted by our current state of emergency. The federal government does not provide adequate support and funding to support refugees and immigrants in their first steps in Massachusetts. And if we want to turn the arrival of newcomers into opportunities for stronger communities and economies across our Commonwealth, we need to create a better statewide strategy for support and coordination. The establishment of a stakeholder commission is a necessary first step. I'm happy to take any questions.
Thank you. Any questions? No. Thank you so much.
Thank you.
Oh, yeah, I'm sorry. Could you come back to the rostrum? We do have one question.
Thank you very much for your testimony, and certainly in the midst of the current migration crisis that we are facing here in the Commonwealth, would you expect that should this bill be successful, it would affect the entire system, including the crisis that it's not ending, that we are going through at the moment to address the needs of refugees who come into the Commonwealth?
I think the passage of this will absolutely support families who are now, reaching out far and wide for basic needs, shelter and food. Most of the families that we serve in the Institute, we are keeping out of the shelter system, and that is because they have access to these federal benefits that some don't. So if we provide access to everyone and we add supplemental funding in Massachusetts, I think that will do a great deal to support families and keep them sheltered and, food secure. Yeah, thank you.
Thank you. Next, I'll welcome up Senator Sal DiDomenico to join us for testimony. Wow.
Good morning, everyone. Thank you, Chair Kennedy and Chair Livingstone and members of the committee taking me out of turn. There won't be a big surprise about why I'm up here today and what bills I'm speaking on behalf of and why these bills are so important to literally thousands and thousands of residents across our state. The first bill I wanted to speak in support of is my bill, Senate 75, an act to lift kids out of deep poverty. We have been working on this bill for several sessions, and we have had some success thanks to the Senate President, the Speaker, and chairs of Ways and Means on both sides, with cash assistance programs being increased incrementally the last several years in the budget. But we all know the budget, doing something as important as in the budget is not the right approach. We should pass legislation to make this permanent and make sure that we give our residents what they deserve. And this bill aims to raise cash assistance programs, the TAF-TDC and EAEDC by 25% until they reach the deep poverty level. Now, deep poverty level, I'm sure you've heard, is 50% below the poverty level. In a state such as ours, it is really unconscionable to have this kind of goal to reach half the limit of poverty. But we all understand that incremental progress is also progress for people who need help today. The people that we're aiming to help here do not have time to wait 2, 3, or 4 sessions to get the support that they need and deserve for their families and for themselves. And even though we're grateful that we've had these gains, we want to see a bill passed that will address this in a meaningful way that's sustainable over time, to make sure we don't have to rely on the budget process every year, the ebbs and flows of the budget process every year, because the people that we're helping can't count on that. And if they get increases this year or next year, and then we drop off, then obviously they're being hurt very badly. So we have to make sure that we have a sustainable process in place to help them. And I'm asking for a favorable report out of this committee. And you have done that in the past. I appreciate that. We're hoping that it can be done soon so we can take this to the floor and get this addressed so families can understand that there's hope and there's a lot more support for them in the future. And the other bill that we're here to speak on behalf of, Representative Cabral spoke very eloquently about it, and I'm the Senate sponsor of the Feeding Our Neighbors bill, which is Senate 76. And, this is another bill that is really a common good. It is really our responsibility to step up and help those that need help the most in our communities. And this legislation would expand the rights given to legal immigrants for benefit programs such as the cash assistance programs I just spoke about, and SNAP benefits that are critically important for themselves and their families over time. And this has disproportionately affected the Latinx and Black communities, and particularly the low-income communities that I represent and across the entire state as well. And during COVID, we understand the impacts and what has happened. And we have folks from La Collaborativa here from Chelsea and on both sides in the orange shirts that if you didn't know, and I'm sure people didn't realize this at the time, but during the pandemic, New York City got a lot of attention because they said that they were the epicenter of the COVID epidemic. Per capita, in the entire nation, Chelsea had the highest infection rate in the entire country per capita. So we know why, and we know what the past has done to communities like Chelsea, where the environmental impacts and the housing crisis and the poverty levels, socioeconomic levels of these communities were a perfect storm for COVID to come into the communities and take over. And that's exactly what happened. And we also know that if we have a program in place that allows them to get more assistance and more benefits, we can minimize those impacts. And we can also show them that there are people in this building that actually stand up and care. The people that I'm talking about today don't have time for the most part to come here to talk about for themselves and to advocate for themselves because they're working 2 or 3 jobs to survive. They don't know what's happening in this building. They don't understand, or sometimes they fear what's happening in this building because of countries they've come from in the past. Government doesn't work for them. At the end of the day, they're not going to know our names or our faces, but they're actually going to know somebody actually cared if we can pass these bills to have an impact on their lives. And that's why it's so important. That's why I'm so passionate about these issues, because I know that if we don't do this, then these families just get pushed to the wayside. And they are not going to be able to support themselves in a family in a meaningful way. And the crisis and the challenges that they face are just going to be doubled and tripled over time. So we have to make sure that we put programs in place that will minimize that and help our families. And it's a pretty simple process. We can pass a bill to do it. So we're hoping for a favorable report on this committee so we can get these things done. Thank you very much, everyone.
Thank you, Senator. Any questions? Thank you so
Thank you.
much. Okay. Next up, we have Erin McAleer. Don't think so.
Good morning. Thank you so much for the opportunity to testify on several important bills under the committee's consideration. Project Bread believes a strong safety net through robust nutrition and cash assistance programs is critical to ensure that all our neighbors and families have the resources they need. For these reasons, we urge the committee to favorably report on an act establishing basic needs assistance for Massachusetts immigrant residents. Every day at Project Bread, we talk to families who are struggling to afford food. We connect many of them to the Supplemental Nutrition Assistance Program, which is our nation's most effective anti-hunger program. Nearly half of our clients through our healthcare partnerships program and a quarter of callers to our food source hotline prefer using a language other than English in accessing our services. While not all of these callers and clients are immigrants, many are, and some of them are unable to access SNAP, not because of their income, but because of their immigration status. In fact, the number 2 reason that a caller who is screened for SNAP is ineligible is based on immigration status. Those denied benefits include individuals who are fleeing violence or humanitarian crisis and seek haven in our state. Many do not immediately have authorization to work or struggle to find consistent, well-paying work. These families deserve access to the same support provided to other residents of the Commonwealth when being faced with challenges meeting their basic needs. Our staff hears over and over how confusing it is for immigrant households that can apply and receive some forms of support and not others. Even when some households are able to apply for SNAP, they may not be able to count the family members with citizenship or the right types of visas. For example, we recently supported a family of 6 that is only getting SNAP for a single child born in the country, and they're only getting 52 cents per meal per person to spend on food. When families in need receive little or no benefits, they must navigate and rely on the food pantry system for their daily food, a system that should be only utilized in emergencies. Massachusetts is a national leader in addressing hunger. We just passed permanent school meals for all, and thank you to all of you for doing that. And the programs and policies we lead on continue to be lifted up nationally. We know the only way to end hunger is through systemic solutions, not charity alone. We have an opportunity here to support immigrant families who have higher than average rates of food insecurity in accessing sustainable food source, which we know will not only benefit their families, but our entire community. This ensures that they can focus on work and education and not on worrying about food. Research on SNAP consistently shows that it's proven to reduce poverty, and recent research just came out that shows 1 year of continuous participation in SNAP is also associated with lower healthcare costs the following year. So we're asking the legislature to put back into place a program that existed before in Massachusetts. Thank you.
Thank you, Erin. Any questions from the committee? No. Thank you so much. Okay. We have two individuals signed up for virtual testimony on these bills. First, I'm going to call Casey Burns. Okay, up next, I'm going to call Mayday Morales. I will return to them at the end of testimony. Okay, at this time, we're going to move on to House Bill 137, an act providing for insurance coverage for vision screening for children. We have one individual signed up for testimony online, and that's Ken Rago. No. Oh, okay. Ken, are you able to hear us? Give you a moment. Okay, we'll welcome Ken back on if he's able to get. I think they said he signed off. Did he sign off? Oh, Ken, are you able to hear us? Okay, we'll welcome you to join us if you could just message LIS when you're able to connect with us. Thank you. We'll move on to House Bill 139, an act relative to funeral assistance. We don't presently have anyone who has signed up in advance. Next, we have House Bill 142, an act relative to community living for older adults and people with disabilities. We have one individual signed up virtually to testify, and that's L. Riley. No. Okay. So next we'll move on to Bill House 144 and Senate 75, an act to lift kids out of deep poverty. We'll start with the in-person testimony. And first we have Omi Amarasham.
Good morning, Chair Kennedy, Chair Livingstone, members of the committee. My name is Omi Amarasingham, and I'm the Deputy Director at the Massachusetts Public Health Association. We are in support of the Lift Kids bill, and I will be submitting testimony on that, although my oral testimony today is focused on another bill that we support. I assume that I should just go forward with that on the HIP bill. Great. So I'm testifying today in support of S85 H150, which would codify the Healthy Incentives Program into statute. MPHA is a champion for public health in the Commonwealth. Our focus is on policies and programs that prevent illness, disease, and injury, and promote health equity among all residents. Health inequities persist in Massachusetts despite our state's reputation for world-class healthcare. At MPHA, we know that the public's health does not begin or end at the doctor's office or at the emergency room, but rather health is created in the social and structural conditions within which people live. That is why zip codes are a predictor of health outcomes, because one zip code reflects one's access to the fundamental building blocks of good health, including access to healthy food. In that context, MPHA has been a longtime supporter of the Healthy Incentives Program, or HIP. We know that when given the choice, all families, including SNAP beneficiaries, purchase healthier food for themselves and their kids. However, several factors make it difficult for low-income families and individuals to buy healthy foods, including lack of access to grocery stores and higher prices at small grocers and convenience stores. In addition to physical access barriers, healthy foods simply cost more. On top of it all, housing costs are rising across our state unchecked, which means that families are forced to spend less on food as they spend more on housing. The Healthy Incentives Program is an important tool that the state has to help families stretch their dollars. And the injection of these funds spent at local retailers means increased economic benefit to local economies. In addition to improving the lives of individuals and families, an increase in healthy eating translates into cost savings to our healthcare system. A 2018 policy brief by Children's Health Watch estimated that addressing food insecurity would save Massachusetts $2.4 billion in healthcare costs each year. And just earlier this year, the Blue Cross Blue Shield Foundation of Massachusetts released a report estimating that health inequities experienced by people of color, including food insecurity, cost the state $5.9 billion annually, including $1.5 billion in avoidable healthcare costs. Upstream programs like HIP that help people invest in their health outside of the doctor's office are critical to achieving health equity in the Commonwealth. There are many complex bills and issues in front of the legislature this year, but fortunately, this bill is not one of them. As you've heard from the bill sponsor, and as you will hear from others who are testifying after me, this bill simply codifies a successful program into statute. With this committee's support, Massachusetts can continue to be a national leader in nutrition incentives. I urge you to report this bill out favorably without delay. Thank you.
Thank you, Omi. Is there any questions? No, thank you so much. I will ask, we have a request from the ASL interpreters that I know everyone has a lot that they want to say in a very limited time, but if you could speak a little bit slower, we want to make sure that the ASL interpreters are able to capture what you're saying for translation purposes, so everyone is able to participate in the hearing. And certainly, as we mentioned before, we welcome all written testimony, anything you're not able to get through verbally here today. So thank you. Up next, I'm going to call Steve Walsh. Okay, seeing no movement. Next, we have a panel, Rebecca Gurwitz and Michelle White.
I'm not Michelle White. I was just about to say, okay, this is not Michelle White. Is it okay if Deborah Harris joins me on this panel?
Okay, have you signed up separately to testify or?
No.
Okay.
Staff person said that it was okay for me to substitute.
Okay, sure, as long as, okay, so you're replacing Michelle. That's
Yes,
okay, yes, by all means, go right ahead.
Okay. Great. So, hi, everyone. Thank you so much for this hearing today. My name is Rebecca Gurwitz. I'm the Executive Director of the National Association of Social Workers, the Massachusetts chapter. We are longtime supporters of House 144, Senate 75, an act to lift kids out of deep poverty. You may not know this, and you may, but nearly 27,000 Massachusetts families with children and 20,000 older adults and people with disabilities are struggling to survive on cash assistance benefits that are far below the level of deep poverty. We heard Senator DiDomenico talk about that before. Just to put that in further context, that's merely $783 a month for a family of three. And that is it. That is all the money that many of these families have, which means that they can't afford necessities of life like diapers, cleaning supplies, winter boots, reliable internet, housing, and everything in between. We know that deep poverty hurts kids. NASW and social workers everywhere recognize that poverty has profound and long-lasting impacts on children's health and well-being. Toxic stress, lack of nourishment, the myriad consequences of poverty significantly increase the risk for learning difficulties in kids who grow up very low income and their worse outcomes in school, sometimes because of bullying, negative self-image, or because their families must frequently move. These are serious injustices and they are costly. Each result in greater state expenditures over time in health and mental health services, in addition to other social services to address the long-term consequences of preventable problems. We believe every kid deserves equal opportunity to succeed, and the foundation for that opportunity is plain and simple, having enough money for food, clothing, and a place to call home. So we can address this problem right here in the State House. We know this is the place to address this problem. I was listening to Erin McAleer's testimony talking about it's not just charity, it's policy change. And that is what we do here. And that is what social workers are focused on, is how do we address these problems further upstream? I want to thank our legislative leaders for their leadership because increases have happened the past several cycles in the grant, but it's not enough. So first, I want to say thank you. And then I want to say we have more work to do. We do know that this state is quite wealthy. I looked just this morning. We are ranked the second wealthiest nation in the entire country. And so I ask, and when people ask me, what do I do for work and where do I go? I come to the State House because what's the purpose of government? What are we all doing here? The purpose is to help each other out. The purpose is to make sure nobody is living in deep poverty in this state, not to mention kids and vulnerable older adults. So lifting our kids through this bill is the right thing to do. It's the smart thing to do economically, and it's the just thing to do, not just for kids living in deep poverty, but for all of our kids, to send a message that this is how we treat people in our Commonwealth. We focus on justice and we focus on policy solutions. So we hope you'll move this bill favorably from committee. Thank you.
Thank you, Chair Kennedy, Chair Livingstone, members of the committee. I'm here because the parent who was signed up to testify, Michelle White, was unable to be here. She was experiencing one of the many crises that beset all parents, but particularly low-income parents every day. She cares for a disabled child, and the bus didn't come. So she was unable to be here today. I'm very sorry that you won't get to hear from her because I know you've all heard from me many times before. I want to specifically thank Representative Decker and Senator DiDomenico for their leadership on this bill. And before I forget, I also want to mention our support as the Lift Our Kids Coalition for the Feeding Our Neighbors bill, Senate 76 and House 135. That bill is really a companion to this bill. We are, as a coalition, as Rebecca said, very grateful to House and Senate leadership for supporting 4 grant increases in recent annual budgets. We especially thank the Senate President for her recognition of the moral imperative to end deep poverty. And also, we know that this has been a priority for Speaker Mariano. This committee, at least in prior incarnations, also played a major role in achieving these 4 budget increases by granting favorable reports to prior versions of this bill. It makes a big difference when the committee gives a bill a favorable report. There's a better chance of getting it included in the budget. But annual budgets are not the place to address this issue. We need bigger jumps in the grant than we've been able to get in the annual budget. The bill calls for a 25% increase, which would still take 2 years to reach half of the federal poverty level, the level of deep poverty. And second, we have to build in a cost of living adjustment because we didn't have a built-in COLA. Grants have lost half their value over the last 3 decades.
Thank you. Thank you. Thank you.
Thank
Welcome.
you.
We welcome the rest written and submitted by written testimony. Thank you.
Thank you.
Any questions from the committee? Thank you so much. Up next, we have another panel, Dr. Eileen Fisk and Dr. Ara Obando. Dr. Obando? Dr. Fisk?
Hi, my name is Eileen Fisk. Okay. I'm a pediatrician and I work in a community health center just north of Boston. I can tell you that the vast majority of my patients live in poverty and the vast majority also do not speak English. I'm here to support H144S75 and to be an advocate for my patients. Sometimes the best way to understand what's going on with families who are living in deep poverty is to tell some stories. So I have some stories for you today. I probably have many, but I'm going to just keep it down to a couple. One is I have a mom with a newborn baby who has no place to live, who's spending time in the house of a friend and sleeping with her newborn baby on an airbed. They don't even have a bed. They have nowhere to go, but at least they've got some shelter. But it's a dangerous situation for a newborn to be sleeping on an airbed. Simple things sometimes, like we have moms who are enthusiastically breastfeeding, which we really support because it's best for the baby. But the baby needs vitamin D drops to support the baby's bone structure. Vitamin D drops cost about $10 for a month's supply. Our families can't afford that $10. And then I have a 2-year-old with a burn on his arm that takes dressing changes a couple of times a day. We can provide through insurance the ointment that's going to help the burn heal. But when I tell mom the dressing needs to be changed twice a day for the next 7 to 10 days, she's holding back tears because she can't afford the bandages to change that dressing. These are common problems for our families who are really living in deep poverty. So I highly support this bill to help them buy simple things and to do some complicated things. But also another baby who's got a congenital metabolic problem. He has a G-tube. He requires very special formula. If he doesn't get it, he will die. The family just sustained a burn in their apartment, so they can't live there anymore. They've had to move to a new apartment, which they did. But the rent is so much higher than the old one that they're really struggling to put food on the table. So they're dealing with lots of stress. This newborn that they're managing quite well, but now they've got this issue with what did they do to buy food for the whole family. And I'm listening to all of these presentations this morning about food insecurity, about needing diapers. And I'm thinking all of this really boils down to needing more money. And that's what this bill will provide for our families, hopefully, if it gets passed. So thank you for listening to me.
Thank you, Dr. Fisk, and thank you for bringing the families you serve into the room here today by sharing their stories. So thank you for that. Are there any questions? No, thank you again. Okay, up next we have another panel, Tiffany Jenkins and Mary Coleman.
Good morning.
Good morning, welcome.
My name is Tiffany Jenkins. I'm a mother of a 4-year-old, and I am a member of Empath Voices Advocacy Council. I have an associate's degree in business, and I'm continuing on to get my bachelor's degree. I'm a small business owner. Also, I'm in the process of becoming a floor laying journeywoman. As you can see, I'm very ambitious, which is why this issue is very important to me. Thank you for the opportunity to speak to you today about the urgent need to raise cash assistance. I first received cash assistance when my daughter was a few months old. It was during the pandemic and everything felt very uncertain. My daughter and I were homeless. We were doubling up with my sister and her kids while I was finally able to get into shelter. At the time, some of the biggest fears were losing my car and not being able to pay my phone bill. With a very small child, I needed my car to get to places like her doctor's appointment, to get her to the sitter, to get to work, and just to be able to commute in bad weather in Boston. I needed my cell phone to stay in contact with my family and my support system and to seek help. I used cash assistance to pay my bills, my phone bill, and my car note, and to get diapers and wipes for my daughter. But it was very hard to make ends meet each month. I was working hard. It felt like they wanted me to fail. It was so expensive to afford apartments in my neighborhood. I sometimes worried, am I ever going to get out of shelter? How do they expect me to get out of poverty? I was very motivated. I worked to go to school while my daughter was in my lap. I took online classes. I was able to obtain a childcare voucher. After several years, I worked hard and I earned my associate's degree this past spring. I started working overnights. Even though I wasn't earning that much, I soon was over income for cash assistance because the grant was so low. I am very resourceful and I asked for help when I needed it, but I know that not everyone is as resourceful as me. And even if they did get cash assistance, it's not enough to make a difference to get them out of poverty. The legislature should set a minimum level for cash assistance to make sure that parents can get real help when they ask for it. Housing and food costs goes up every single year. Why doesn't cash assistance? Not everyone wants to live off not everyone wants to live off public assistance all their life. Many of us just need that extra support to make real positive changes in our life. Notice how I use the word support. Support is encouragement given to someone because you truly want them to succeed. So let's eliminate the stigma behind public assistance and start offering public support. Thank you for listening.
Thank you.
Good morning,
Morning.
Senator Kennedy and Representative Livingstone. As we've just heard, the grants traditionally have not paid nearly enough for families to meet basic needs. Since 1988, these grants have really not covered the cost of inflation in the Commonwealth. And as has been said all morning long, the Commonwealth is very wealthy. And for the most part, this committee, and I think this state government, has done exceptionally well trying to think through how to eliminate, mitigate, and prevent inequities. My name is Mary Coleman. I'm Senior Vice President and Chief Operating Officer at Empath. Empath serves 1,400 families a year in emergency assistance, transitional housing, and economic mobility coaching. And we know for sure that families have the capacity to lift themselves out of poverty, not to mention deep poverty. So we're here today to testify in support of Senate Bill 75 and House Bill 144. As I just said, these bills call for a yearly 25% increase in grants until the benefit amount reaches the deepest poverty level. This would help to ensure that more than 66,000 children throughout the Commonwealth are no longer living in deep poverty. As a state, we can and must ensure that children and families are adequately supported and have the resources they need to thrive. We appreciate your listening to this testimony and fully expect you to do all that you can to help lift children and families out of deep poverty. Thank you.
Thank you, Tiffany. Thank you, Mary. Any questions?
I just have a comment, and I can appreciate how difficult it is to tell your own story. And for me, stories are what binds us. And so those stories are very impactful, I think, for all of us, in order for us to make the decisions that sometimes are difficult for legislators to make on behalf of children and families in the Commonwealth. So I appreciate all the testimony in this regard. Having been a guidance counselor in an elementary school in an urban district, I have seen over the years the poverty that you describe. And so I particularly appreciate your testimony. Thank you.
Thank you.
Thank you. Thank you.
Thank you.
Okay, we have another panel, Aaliyah Talatson and Egla Malaj. Welcome.
Hello, everyone. My name is Eglantina Malay, and I'm currently a clinical social worker for Somerville Public Schools. My passion is working with children. Throughout my 14 years as a social worker, I encounter every day the impact financial insecurity has on our children. On a daily basis, they carry with them the burden of the thought that this may be the last month their parents can pay rent. This may be the last meal they can afford, or they may not have a coat for this winter. I wish I had time to talk to you about all the wonderful people. Sorry. I have worked with and their stories. But due to lack of time, I'll talk to you about Daisy. She's a real person, hence I apologize. Daisy is a hard-working mother of a 13-year-old boy and an 18-month-old girl. She also took in her 16-year-old sister who fled a violent situation in her country of origin. When Daisy got pregnant with her second child, she had to quit her job at the dry cleaners. The money she made was far enough from paying for daycare alone, let alone anything else. COVID hit this family financially hard, and they decided to move in with Daisy's brother and his family. And this was their only way to afford the $2,400 a month rent. Due to no fault of their own, Daisy's husband moved back to their country of origin and cannot return. He was the only financial support they had. Daisy applied for cash benefits and was approved for $688 a month. That money is supposed to pay for rent, utilities, transportation, clothing, school supplies, and all other household needs for Daisy and 3 children. It is impossible to provide for our children with these funds. The family also receives $516 a month in food stamps. That may sound like a lot of money. However, if you do the math, that is $1.43 per meal per day for each family member. When was the last time any of us had a nutrition meal for $1.43? People often ask me, how do you do your job? And I tell them, my job is easy. What's hard is being powerless to help wonderful people who are severely struggling financially. What's hard is hearing one more person saying that people are poor because they're lazy, while I know that we have plenty of money to help the needy. We will just never have enough for the greedy. So I'm here today to ask this committee to raise cash assistance grant levels to make sure no families are left in deep poverty. Thank you for listening.
Good morning. Thank you for allowing me to be here. My name is Aaliyah Tillotson. I am a family services manager for LEO, which is the community action program in Lynn. I work specifically for the Head Start programs. About a little over 10 years ago, I was a homeless parent and the recipient of TAFDC. During that time, I struggled to stretch that money out. I was responsible. It just was not enough during that time for transportation, for hygiene products, for diapers. I can recall a time that I was in my doctor's office in tears asking for diapers because I just did not have enough money left. I was fortunate enough to land at Leo and be able to get support to get my associate's degree, my bachelor's degree. I'm currently in the master's program, working on my master's in social work. In my work with Leo, it's difficult to see that 10 years later, families are still having those same struggles. I would say even worse, because obviously, 10 years later, the cost of living has risen exponentially. Also, a lot of our families don't have English as a first language. They are trying to stretch that money. A lot of them are renting rooms. So that's the entire benefit right there. The same struggles, diapers. Many other people gave testimony this morning, even for different bills. The struggle is there, the diapers, transportation, hygiene products. It's heartbreaking to watch families go through the same thing, especially being a person who understands firsthand the impact of poverty. So I just want to say thank you for hearing me today, and also just how important it is to raise those grant levels for these families. Thank you.
Thank you so much, both for sharing your experiences, and thank you for pursuing your master's in social work. We know there's a great need in our community. So thank you both for being here and for sharing your stories. Any
Thank you.
questions? No,
Thank you.
Thank you again. We're going to move to individuals that have signed up virtually to testify. First up, we have Deborah Powers.
Good morning. Thank you
Morning.
all for listening to my testimony this morning. I appreciate it. My name is Deb Powers. I work with the Worcester Food Policy Council and help manage a mutual aid page in Worcester. I'm here to speak today on an act to lift our kids out of deep poverty and on an act to protect the safety net. And honestly, I'm feeling a little bit like the woman in the internet meme that's holding up the sign that says, I can't believe we're still talking about this. Because in 1993, I was a single mom, dependent on AFDC to raise 3 children. A community advocate asked me to talk to a congressional committee about how I made ends meet. And the short answer was, I didn't. And my family suffered because of it. Each month, I received $668. This was 1993. My rent was $575. That left me $93 to pay for gas, electricity, diapers, toilet paper, dishwashing liquid. I washed laundry in the bathtub with dishwashing liquid. I begged for money from my neighbors so that my kids could go on school trips. And my kids got used to taking cold showers in the summer because I couldn't afford to pay the rent and the gas bill, and a roof was more important than a hot shower. It's 30 years later, my kids are doing great, and I'm still hearing the same things from people in the community. Not only have things not gotten better, they've gotten so much worse. My grant in 1993 met 60% of the federal poverty level. Today's grant, a family in my situation, gets just $933 a month. That's 37.5% of the federal poverty level. I had some money left over after paying rent. They can't even make half the rent. Forget about buying toilet paper. When this bill is fully in effect, it will add about $200 a month to the income of a family of 4. That $200 will pay off in happier, healthier families who won't have to take cold showers all summer. I'm asking the committee to move the Lift Our Kids Act forward with a favorable recommendation for the sake of all of our kids. I'm asking the same for an act to protect the safety net. When state agencies that support vulnerable people move their physical location, it can create nearly insurmountable barriers for the people most in need. This bill will require the kind of public participation that will take into account the needs and experiences of the people who use their services. Thank you very much.
Thank you, Deb. Thank you also for sharing your experience and for the work you do in Worcester. And I can validate your kids are doing more than great. So thank you so much. I appreciate that. Next, we have, I forgot to ask if there's any questions. Next, we have Catherine Juniak.
It's Janik. No. So thank you, Chair Kennedy, Chair Livingstone, and the members of the committee for allowing me to provide oral testimony for House Bill 144 and Senate Bill 75, an act to lift kids out of deep poverty. My name is Catherine Janik, and I am a Master's of Social Work student at Boston University School of Social Work. I went into my Master's of Social Work program because when I was seeking a diagnosis for whatever disability I faced, social workers were the people who prevented me from falling through the cracks within the many systems in Massachusetts, whether they be social welfare systems, the healthcare system, or the mental health care system. I wanted to be that person for the people who would inevitably end up in my shoes. Children with a physical disability are 3.3% more likely to live in deep poverty and 9.4% more likely to have an intellectual disability. The current social welfare policies that we have in place allow for disabled individuals and families caring for disabled children to fall through the cracks for a variety of reasons, whether it be long wait times to qualify for programs, not preparing for the program, forced poverty to keep benefits, and more. Additionally, the current cash assistance program is not adjusted for inflation. House Bill 144, Senate Bill 75, an act to lift kids out of deep poverty would be adjusted annually for inflation and set cash assistance of 50% of the federal poverty limit. This would help bridge the gap for families who needed assistance but did not qualify for other social welfare programs. Living in deep poverty goes hand in hand with having a disability. As a Master's of Social Work student, I feel this legislation would benefit the state as a whole, as families and individuals living in deep poverty add an additional strain on the healthcare system to assist them with their basic needs. It is known that deep poverty can cause long-term health consequences for children, both physical and mental. Thus, the Commonwealth should feel incentivized to invest in its youth, as it will have a long-term payout. Thank you for your time and consideration. I request that this legislation receive a favorable report by the committee. Thank you.
Thank you, Catherine, and thank you also for pursuing your master's in social work. Any questions from members of the committee? No. Thank you again for your testimony today. Next up, we have Brianna Zimmerman.
Hello. Thank you, Chair Livingstone, Chair Kennedy, and members of the Committee on Children, Families, and Persons with Disabilities for the opportunity to testify, especially virtually today from Western Mass. I'm testifying in support of H144 and S75, an act to lift kids out of deep poverty. Stavros Center for Independent Living urges the committee to give these bills a quick and favorable report. My name is Brianna Zimmerman. I'm the systems change advocate at Stavros Center for Independent Living in Amherst, Massachusetts. Our center is a nonprofit, private, non-residential organization that provides services and advocacy for the disability communities in Hampshire, Hampden, and Franklin counties. Over half of our staff are people with disabilities as well. We serve many low-income older adults and people with all types of disabilities. We're especially interested in this issue as disability advocates because TAFDC and EAEDC assist many individuals with disabilities, including parents with disabilities, children with disabilities, older adults with disabilities, caretakers of people with disabilities, and non-elderly adults with disabilities. EAEDC is a lifeline for people who are unable to work due to a disability, people who are waiting for Social Security payments to begin, people with disabilities who are participating in MRC programs, and people who care for children and people with disabilities. TAFDC is also a lifeline for low-income families. Many of the populations we serve fall under these categories and receive some sort of cash assistance. An act to lift kids out of deep poverty will set a floor for cash assistance at half of the federal poverty level. And as you know, anything below half of the federal poverty level is considered deep poverty. Raising cash assistance is vital to ensuring that everyone is able to afford their basic needs. People with disabilities and their loved ones are significantly more likely to be low income for a number of reasons, facing discrimination in employment, barriers to securing employment. Some of us are unable to work due to our disabilities, and we all have added expenses to cover, including healthcare, medication costs, costs for durable medical equipment, caregiving, and making our homes accessible. Many of the consumers that we serve can't make ends meet with the current cash assistance they receive, and they are living in deep poverty. There's a huge inequality in who accesses home and community-based services, and often people in poverty cannot access those services. Although we're not able to provide testimonies on all of the bills we support today, I want to note that we also support H135 and S76, and we also support S2434 and H3870. And we ask that you report all of these bills favorably out of committee, and I'll submit written testimony on those bills as well.
Thank you, Brianna. Appreciate that. Any questions from the committee? No? Great. Thank you so much for your testimony today. Okay. I'm going to call Dr. Arobando to testify. Welcome. You'll have 3 minutes to testify. Thank you.
Chairs and members of the committee, thank you very much for the opportunity to address you today. My name is Dr. Aura Obando. I'm an internist and pediatrician and the medical director of the family team at Boston Healthcare for the Homeless program. Our team provides medical care to families experiencing homelessness and housing insecurity. 100% of our patients are living in deep poverty. Day in and day out, in our clinical encounters, we witness firsthand the profound effects of poverty on child and family health. Poverty is in fact the most significant driver of homelessness in our patients. The cost of living in our state has far exceeded the low-income housing stock and made it impossible for the families I care for to pay for an apartment in addition to childcare, food, and other expenses. Just this week, I wrote a utility shutoff prevention letter for one of my primary care patients who is now marginally housed, a single mother to a special needs child with autism, forced to make budget trade-offs each month, such as choosing to pay for utilities over groceries due to insufficient funds for those most basic necessities for her family. Homelessness is associated with a number of detrimental health conditions, both in the short and long term, such as childhood malnutrition and obesity, behavior and emotional problems, and in adulthood, chronic illnesses such as hypertension, diabetes, depression, substance use, and adult homelessness as well. Providing an economic buffer in childhood will prevent some children from experiencing homelessness, reducing their risks of these complications. Food insecurity is also pervasive in our patient population, as food stamps often are insufficient in covering the full family's needs, with nearly every patient reporting hunger during our visits. We also receive frequent requests for help with transportation to medical appointments and the necessary equipment to be able to transport a child from a shelter to a medical clinic, such as car seats and strollers. Often these basic needs are cost prohibitive for our families. Further, childhood poverty is closely linked to increased environmental exposures. Unfortunately, this bears out in my very own clinic with needs for medical visits for elevated lead levels, asthma exacerbations due to dust and mite exposure, and mental health needs related to witnessing domestic violence. I want to tell you about an infant I saw recently in clinic brought in by his mother due to a severe beefy red diaper rash covering his entire perineum. His skin was raw in several areas and he was bleeding, and diaper changes were excruciatingly painful for him. I wish I could say this was unusual for our clinic, but we regularly see families who have to reuse or overuse wet diapers because diapers are an expense that exceeds the monthly budget allocated to families in shelter. This leads to unnecessary medical visits, missed days of daycare, and as a result, missed work for parents. Further, it's important to note that child poverty impacts parental health as well. The stress of poverty and feelings of inadequately being able to provide for your children lead to poor parental mental health. Raising the floor on cash assistance is a very concrete way to reduce these detrimental health effects for the children to care for, as well as for their parents. These bills lifting kids out of poverty are an opportunity for us to prevent some serious health problems in children. Let's do all we can to allow this next generation to thrive, as they are the future of our Commonwealth.
Thank you, Dr. Bondo. Any questions? Thank you so much. Okay, next we're going to move on to House Bill 146, Senate 72, an act ensuring access to behavioral health services for children involved with state agencies. We have an in-person panel, Amara Anosike and Asha Kariki. Welcome.
Good afternoon, Chairs Kennedy, Livingstone, and esteemed members of the committee. Thank you for the opportunity to testify in support of H146 and S72. My name is Amara Anosike, and I'm the Director of Behavioral Health Policy and Advocacy at Boston Children's Hospital, and also on the leadership team of the Children's Mental Health Campaign. As you know, for several years, there's been a nationwide behavioral health crisis that has contributed to children in psychiatric crisis flocking to emergency departments. Many families find themselves in a catch-22. They are not well enough to go home, yet there are no inpatient psych beds available, so they have to wait for days and weeks in inappropriate settings. As the Commonwealth's only acute care freestanding children's hospital, Boston Children's sees a third of the state's pediatric behavioral health borders. In my role at Children's, I advocate on behalf of our patients on a daily basis, striving to break down administrative barriers to access. While there remains a shortage of acute care beds to meet the need, there are also countless examples of children who are boarding for no other reason than administrative complexity and a lack of coordination. The silos that persist among government agencies like DCF and the health system are causing the most vulnerable children in our state to board for longer periods of times in inappropriate, non-therapeutic and restrictive settings. Some children don't even require treatment. It's not uncommon for a child to be admitted to the hospital from a group home or foster placement that is no longer willing to keep the child, resulting in children that are in DCF custody living in places like Boston Children's Hospital without any health need. For lack of a better term, many children are stuck in hospitals throughout our state. A Massachusetts Health and Hospital Association study showed that in December 2022, 83% of the 69 pediatric patients who were stuck in hospitals without a health need were state agency involved and were in DCF custody. Moreover, there are so many children that actually need that treatment and desperately need access to the services that are being diverted to provide care to children who no longer need it. There have been many times during our busiest seasons at the hospital that we've had to postpone all elective procedures due to capacity constraints. H146 can mitigate some of this by creating a presumption that a child should return to their congregate care placement following a hospital stay. In a moment, you will hear from Asha Kirki, a social work manager for Boston Children's, who will share her experience with patients. In hearing the stories that Asha shares, it's important to note that this is a matter of equity. Children who are in DCF custody, for the most part, do not have their parents or caregivers by their side fighting for them to navigate the many barriers that persist in our system. And no one is a better advocate than a parent. I see firsthand how families with privilege and the right connections are better equipped to navigate the system and can more readily access care. However, every child deserves the same access to timely care. It's critically important that there are equitable systems in place so that children in DCF custody who are disproportionately Black and Brown aren't being left behind. H146 and S72 will bolster systemic protections by ensuring that group homes have sufficient crisis plans in place if a child in their care has a behavioral health crisis, and by improving communication between DCF and healthcare providers.
Good afternoon, Chairs Kennedy, Livingstone, and esteemed members of the committee. My name is Asha Kariki, and I'm a social work manager at Boston Children's Hospital, and where I oversee the emergency psychiatry service. I'm here in strong support of H-146S72, an act ensuring access to behavioral health services for children involved with state agencies. Emergency psychiatry has become one of the fastest growing needs in the last 10 years, and even more so since COVID-19. This rise in ED visits is a result of children not being able to access timely care in the community, so they come to the ED in crisis. It's not unheard of to have 50 kids waiting for psych beds, with many of those kids being in DCF custody. Other kids that are in DCF custody are often left in the ED when there is no health issue, but simply because it's an available bed. I would like to share a story of one of those kids who I'll refer to as John. John is a 12-year-old transgender male of Vietnamese descent who first came to us when he was 9. Following a disclosure to our team about being sexually abused at home, John was quickly removed from dad's custody and placed in a group home. We've taken care of John for over 3 years now, during which time he remained at his group home while he continued to receive psychiatric care. But on his most recent visit to Children's, John was unfortunately informed that after he completed psych treatment, he could not return to the group home where he lived for over a year because they believed he was no longer fit for the setting, despite being deemed medically appropriate to return. And after that, we struggled to find John even the psychiatric care that he needed because all the inpatient psych units refused to accept him without a place for him to go post-discharge. We spent weeks trying to get DCF on the phone to coordinate care between the hospital and his previous group home. Meanwhile, John decompensated in a room with no windows, no fresh air, no security or certainty. Eventually, John was admitted to an inpatient unit where he had been treated before, but he had no concrete plan post-discharge. John is not a unique case. While we understand the strain the DCF system is currently under, the ED is not a hotel, and children like John deserve more. The emergency room is for sick patients. Instead of focusing on care for sick patients, we're often tasked with telling DCF-involved youth that they're not wanted back in their home and made to explain why they have nowhere else to go. We spend days making phone calls to DCF caseworkers to find out what's going on, only to be met with voicemail boxes that are full or no return calls for days. We often feel that these kids are out of sight and out of mind.
Thank you so much. Appreciate your testimony. Please do submit the rest by written
Okay.
so we can understand it. Thank you.
We feel they're out of sight and out of mind for
Oh,
DCF.
I'm sorry. I'm sorry. Please submit it as written testimony. My apologies.
Sorry, what?
Written
Okay.
testimony after. Sorry. Thank you. Thank you. Are there any questions? Yeah. please.
Thank you all for sharing that. And I wish that was the first time I had heard stories similar to that, but even in central Massachusetts, I've heard equally challenging stories about individuals that have been boarded for months because of and some of them may have had medical complexities and couldn't find a proper placement. During that time, and you could reference that particular child that you referenced or another case, what's going on with how are these children getting to school? And while that child is placed in the ED, or anywhere, what is the role that's going on, either getting that child to school or the relationships with the school, or even just the contact with the social worker or the individual that brought that child to the ED in the first place?
They're not going to school. If they're in the emergency room, they're in the emergency room and they're not leaving. If they need psychiatric care and they're waiting for a psych bed, they're not leaving the hospital because it's unsafe for them to do so.
Okay, I'm sorry. So, sorry, let me clarify. So once they've been medically cleared and you've got that person that, should be going to the group home in your opinion, and the group home's not taking them, but you've medically cleared them, are they still not going to school?
They're not going to school.
Okay, thank you.
Can you speak to the rooms that these children are in? Because I understand they're sort of separate and different than the usual ED rooms, right? And the impact of the longer stays in these kind of rooms. Yeah.
I'll let you finish off the question, but some of the rooms have been augmented for safety, for instance, like ligature risk. I don't know if you want to talk about if that's what you meant, but I mean, they look like a regular hospital room, like you mentioned, no windows, and there are things in there, medical supplies for treating children who need medical treatment.
It's a standard ED room, no windows. The safe rooms are reserved for kids who actually need to be in a safe room. These kids don't take up safe rooms because they're not unsafe.
Okay, thank you for that clarification. Is there any follow-up to see sort of what impact it has on the children and their behavioral mental health, just having had these long-term stays? I suppose meaning like, is that creating secondary trauma for any of these kids or creating sort of new situations that weren't present when they were first admitted?
I imagine it does. I don't have any data on that right now. Mara, I'm not sure if you have any.
We're happy to share some information that we do have after the hearing, but of course, it's not a pleasant state. I mean, anybody staying in a hospital room for days and days would be impacted by that. And can I just follow up on your question too? Although the kids aren't in school, we do a lot of coordination with the schools and the districts and trying to figure out the appropriate placement. So there's a lot of communication. Unfortunately, while they're in the hospital, they aren't going to school.
Representative Doherty, do you have a question?
These stories are always befuddling to me, and one of our responsibilities is to oversee the responsibility of the Commonwealth for the care of these children who are in state care. So what I hear you saying is that children are sent to a hospital for whatever reason, they're sent behavioral issues, probably, and that the facility from which they come refuses then to take them back. And they languish, much like adults who have mental health issues, languish in a hospital setting until such time as there is a bed or a placement available to them. So what aspect, I haven't had an opportunity to read the bill thoroughly, so I apologize, but what aspect of this bill, so I read it, the establishment of the commission, reading a summary, the establishment of a commission and other guarantees for behavioral health services, what aspect of this bill would identify the need for more beds and placements and the responsibility of the state to generate those facilities?
First, I would say there would be a presumption for that bed to remain open after hospitalization. So I think that's critically important. If that bed is not being taken up by a patient who actually doesn't need it, then the throughput in the hospital is improved if that patient is able to return to their congregate care setting. Also, this bill would require DMH, the Department of Mental Health, that actually has their own placement sometimes, to be involved when a DCF patient has a behavioral health need. And I think that's critically important too, to make sure all of the state agencies are at the table. It would also require the group home and DCF to communicate with the healthcare facility, because oftentimes it might not actually be that there's not a bed, but there's just a lack of coordination and responsibility on who's responsible to finding the bed and pay for the bed. So I think some of that will assist with that. You'll find, I know MHA was probably going to provide comments, but often it's not about, there are a lot of beds, but the workforce issue is a challenge that needs to be solved. Payment issues, the administrative complexity, and what's available when it's available. So I think the bill can help in coordinating some of that.
Thank you so much.
Do you mind if I just say, or I guess it's like a comment / a question. I mean, it's really frustrating to hear that you're going through this situation, because like when we had the David Allman oversight hearing, a lot of the emphasis was on, the introduction of new education coordinators specifically because there were oftentimes of that, but also DCF implemented, and I think it was before my time in the legislature, a medical social worker program to provide extra specialty to the regional offices to navigate through this. So I just want to follow up on how that, I'm going to follow up in my office, just how that information is being communicated and how that system is working, because that's just really disappointing to hear, because there was a lot of efforts that was done to try to reduce this, and the fact that it's still going on is troubling. So thank you for bringing that to our attention.
Thank you.
Thank you. Okay. Up next, we're going to move on to House Bill 149, Senate Bill 104, an act establishing a diaper benefits pilot program. And we're going to begin with individuals who have signed up virtually to testify. And first up, I have Jenny Collier. Welcome, Jenny.
Good afternoon. Thank you, Chair Livingstone and Chair Kennedy, for allowing me the time to speak today in support of Senate Bill 104 and House Bill 149, an act establishing a diaper benefits pilot program. My name is Jenny Kaur, and I'm the program manager for the United Way of the Franklin and Hampshire Region Diaper Bank. Thank you for reporting these bills out favorably during the last session and for welcoming me today and considering my testimony. The United Way Diaper Bank works toward ending diaper need in our communities of Western Mass by supplying 14 local pantries, family programs, health centers, and survival centers with disposable diapers, pull-up training pants, and wipes free of charge. We distribute over 10,000 free diapers every month, and while this amount makes an important difference in our region, the need for diapers remains high. A June 2023 study by the National Diaper Bank Network, which we at United Way are a member of, found that nationally, 47% of families with young children struggle to afford diapers. Many working parents rely on childcare, and most daycare and early education facilities require parents to provide disposable diapers for their child. SNAP and WIC cannot be used to purchase these essential items. We see the effects of diaper need locally in the Franklin County, Hampshire County, and North Quabbin towns that we serve. Our partner agencies report that an average of 37.5% of the families they served with diapers in the last year live below the federal poverty level. An increase in immigrant families settling in our communities, along with ongoing regional struggles, include housing, food, and fuel costs, substance use, equitable access to health care, and mental health all drive the continued local need for basic diapering supplies. Robin Bielecki, director of one of our partner agencies, the East Hampton Community Center, shares, "It's really impossible to state all of the many thanks and comments of gratitude I receive from parents and grandparents of the families we serve. Diapers are such a daily need and so critical to the health and well-being of our children. We see a larger number of new children being born to our new immigrant families. I'm so grateful for the assistance from United Way to obtain diapers and pull-ups. We've had to limit diaper distributions to every other week as a result of these larger numbers of families and the increased numbers of children per family." For the United Way Diaper Bank and many other diaper banks in the state, support from these bills would mean a bigger capacity to better meet current needs, as well as the ability to grow the network of agencies, families, and collaborative initiatives from our region that could benefit from the bank. These bills would create a stable network of diaper distribution across the state, allow diaper banks to stretch funds, and provide the financial support to operate and expand their services flexibly. I once again urge you to please support these bills and as you consider the impact they would have for our state's children and their future. Thank you for your time and all your work.
Thank you, Jenny. Is there any questions? No. Thank you so much for your testimony. Up next, we have Lacey Giro.
Thank you. Good afternoon, chairs and members of the committee. My name is Lacey Giroux, and I'm the manager of state policy for the National Diaper Bank Network. I want to thank you all for your time and for considering Senate Bill 104, House Bill 149, and House Bill 225, which all work to address diaper need, the condition of being unable to provide enough diapers to keep your baby clean, dry, and healthy. As Jenny mentioned, the National Diaper Bank Network's Diaper Check 2023 finds that nearly 1 in 2 U.S. families with young children are experiencing diaper need. This is a sharp increase from previous studies that showed approximately 1/3 of families experience diaper need, which is representative of the increase in demand that diaper banks are seeing across the state of Massachusetts. The National Diaper Bank Network works with more than 300 basic needs banks serving local communities in all 50 states, DC, and Puerto Rico. In Massachusetts, we work with the Massachusetts Diaper Bank Coalition, which is composed of diaper banks across the state who are working to address the need in their local communities. Senate Bill 104 and House Bill 149 would create an opportunity for diaper banks and nonprofits to apply for grant funding to address diaper need across the state. The opportunity to apply for this grant will be impactful for families across the Commonwealth, as diaper banks will be able to leverage the funding and utilize best practices already in place to serve more families. With additional funding, diaper banks are well equipped to further address the unmet need across the state. Furthermore, an investment in diapers is an investment in families and economic growth. When low-income families cannot afford enough diapers, parents cannot go to work. And when diaper need is a barrier to childcare, Adults miss an average of 5 workdays a month, perpetuating a vicious cycle of poverty. A Connecticut study on the economic impact of diaper banks found that parent income increased by $11 for every $1 invested in diaper assistance. Diaper need is also tied to food insecurity and, not surprisingly, stress. 10 other states are currently directly investing in diaper banks, including neighboring Connecticut, Vermont, and New York. We also support House Bill 225, which would provide TANF families a stipend for diapers. This legislation has already been passed in California, Washington, and New York. Massachusetts should also pass this legislation to directly support families struggling to afford these basic necessities. Together, these 3 bills have the ability to make a huge impact for the parents in this state that are currently struggling to figure out where their next diapers are going to come from. These bills moved out of committee last year, and I hope that you all can support them again this year, and in doing so, support the families struggling and the nonprofits that are working hard to address the need in the state. Thank you.
Thank you, Lacey. Any questions? No? Thank you so much. Up next, we have Karen Boyer.
Thank you. Good afternoon, and thank you, Senator Kennedy, Giannino, Representative Rauch, and Livingston, for allowing me the time to speak today in support of Senate Bill 104, House Bill 149, as well as House Bill 225, all addressing diaper need. My name is Corinne Boyer, and I'm a family nurse practitioner and a board member representing the Berkshire Community Diaper Project. We're an all-volunteer organization, and we've distributed over 2 million diapers since 2014. So a few stories. Recently, Mary is a volunteer at one of the food banks that distributes our diapers, related a story perfectly illustrating diaper need in Berkshire County. A young family with twins and a newborn had resorted to using napkins from McDonald's instead of diapers until they found Mary's Food Bank in Pittsfield, one of our 23 diaper bank partners. Now, we know the perception of the Berkshires is that of a wealthy county, but the number of families on WIC in Berkshire County has actually increased 50% since our organization's inception in 2014. And this is a monumental increase in the number of poor families. It also correlates with our internal data as well. Our organization is experiencing over a 61% increase in the call for diapers across all our partner sites since 2022. So even with all our grant writing, diaper drives, and fundraising efforts, we're scrambling to stay within budget this year. One last story to leave you with. Earlier this year, a North Adams police officer was called to the scene of a domestic dispute. It erupted over diaper money. Mom didn't have money for diapers, and Dad claimed he didn't have the money, and tensions were escalating until the officer said he couldn't help with the money, but he would get them the name of a diaper bank near where they live. And the next day he called us at the Community Diaper Project, and we gave him the address of our diaper partner in North Adams. We want to continue to be of help and assistance. So in closing, I urge you to pass House Bills 149, H225, and Senate Bill 104. Please help us help our underserved families and the babies of Berkshire County. Thank you.
Thank you. Any questions from the committee? No? Thank you so much. Up next, we have a virtual panel that includes Lisa Smith and Kim Goulet. Lisa Smith
Hi.
with us?
I am. Can you hear me?
Yes,
Oh, let me see. Is my camera off or is it on?
it is off.
Join as
You can go ahead and begin, or?
Can you see me?
No, your camera appears to still be off.
Oh, boy. There we go.
There you are. Welcome.
Let us start. Thank you. I'm Lisa Smith. I'm good morning, Chair Livingstone and Chair Kennedy. I'm Lisa Smith. I'm the Executive Director at Neighbors in Need in Lawrence, Massachusetts, and we run mobile market style food pantries in Greater Lawrence, serving 1,600 families, and also a diaper pantry that serves about 600 families, a little bit less than that, about 550 families each month. And we're also partnering with Community Giving Tree to operate a diaper bank that serves 5 partner agencies. Thanks for the time to speak today. We're in strong support of Senate Bill 104 and House Bill 149, the act to establish a diaper benefits pilot program, as well as House Bill 225, an act relative to the Department of Transitional Assistance benefits for diapers. And we are grateful that these bills got reported out last session, and we're hopeful that the same will happen this year in this session. Our organization turned 40 years old this year, and for most of this time, we've been distributing diapers. During the Columbia gas crisis and also the COVID pandemic, our program exploded, no pun intended there, almost tripling the number of diapers we distributed. In 2021, we served 300 families a month. In 2022, this grew to 420 families. And now, as I said, we're about at 550 families each month. We've also increased the number of diapers we provide. Some of our smaller size diapers we give as many as 50 a month, and the larger size pull-ups about 15. We distributed 163,000 diapers in 2022, and we're exceeding that this year. The numbers of diapers that are donated to our organization no longer meets this need, and we need to buy diapers. We got funding for this, but we were limited in the beginning by purchasing these retail, and we needed to scale up. There was not a diaper bank serving our area, so we partnered with Community Giving Tree. We applied to be a member at the National Diaper Bank Network to access their purchasing program, and we found a warehouse space with a loading dock, no small tasks. And we secured our first funding in June of 22. Last year, our first year of our diaper bank, we distributed 128,000 diapers to these agencies, and it's nowhere near meeting the need. We estimate conservatively that this is way conservative, way less than the 1 in 2 families experiencing diaper need. But if we went to a conservative number of children on WIC, we think there's 6,000 children who need help with diapers, and we may be meeting, that means like 3.6 million diapers are needed, and we're distributing less than 1 million. So huge amount of unmet need. We're really hopeful that this legislation will get out of committee to help us meet this increased need and demand. Every family deserves basic needs to be met, and diapers are the most basic of needs. I'm going to pass this on to Kim Goulet now for her portion of testimony, and look forward to your questions.
Good afternoon, Chair Livingstone and Chair Kennedy and committee members. My name is Kim Goulet, and I'm the Executive Director of Community Giving Tree. Community Giving Tree bridges the gap between donors and local children in need. Our team of staff, volunteers, and agency partners work together to distribute recycled and new necessities across northeastern Massachusetts. Children grow and thrive when they have access to appropriate clothing, diapers, cribs, car seats, and other safety equipment. Community Giving Tree alone distributed over 147,000 diapers in the past year. Our diaper issue is greater than getting diapers in the hands of families that need them. It is also important to keep our children healthy. A child sitting in a diaper all day because of a cost is unthinkable. Our diaper distribution number is up significantly higher from the prior year, increasing our distribution by 32%. This number would be much higher if we actually had the diapers we needed. Community Giving Tree served over 15,000 children last year. 46% are from Lawrence alone, and 77% are under 5 years old. We all know that children need diapers in daycare and maybe pull-ups in school. Without these diapers, daycare and school is not available to families that struggle financially to make ends meet without support for diapers. Community Giving Tree has been out of diapers for over a month now. We had to make the decision to either lessen the amount of diapers we give out per child or just not have diapers available until our next shipment. We continue to go to the same pool of donors over and over again. Using social media has helped with the demand, but sadly, it is clearly not meeting the need. Thank you for your time.
Thank you both. Any questions from you?
Hello, I wanted to say hello and thank you from the Merrimack Valley. With the recent weather that has come through and caused some devastation to our area, have you guys seen an increase in need in relation to these emergencies?
You know, I think that's a really good question. I think this act actually helps communities better prepare for crisis. So as you heard Kim speak about, and we've faced, there's a huge need. We can't keep up with the need. We need more resources to have the supplies on hand so that when things like the gas explosion or the pandemic or weather events happen, we can help. September in general is a very difficult month for families with back to school expenses. So our typical September, it's like January and September tend to be our largest months. So I would expect record numbers this month. And as I said, you know, it'd be great if something happened in our community, if we had enough supply, we could go and drop off diapers at the cooling centers in North Andover and Andover, and that would just be there for families when they needed them. But we can't do those things without additional resources.
And just one follow-up question. I see in the text of the bill itself, it limits it to 2 organizations in the Merrimack Valley and certain other areas. How would that work where you are a collaboration of multiple organizations?
I think we would apply as just one organization. Currently, we are a partner, and the grant, the grant funding we have, Neighbors in Need applies for, and we're partnered in that grant. So we share resources with Community Giving Tree as part of that grant, but the bank itself operates as a partnership and we receive funding. Neighbors in Need in particular receives the funding, and then we share those resources with Community Giving Tree. So I haven't seen this current, the grant application and this particular piece of legislation, but I would assume there would be a way that would allow for partnerships. And I would hope encourage that, because I think that's a way that we can strengthen the relationships within our individual communities so that we're all kind of working together, which we already are anyways, but.
Thank you. And thank you so much for all the work you do.
Thank you so much. Up next, I'm going to welcome Senator Joan Lovely to testify.
Thank you, Chair Kennedy and Chair Livingstone and members of the committee. I am sending written testimony, so I will be very brief. I just want to offer my strong support for these 2 bills that I have filed with our House colleagues, Representative Pignatelli and Representative Dom, who I am extremely grateful to for their hard work working on this throughout their districts and across Massachusetts. One statistic that really sticks out to me is, according to the National Diaper Bank Network, approximately almost half of families have reported diaper insecurity in 2023 across our state. That is just staggering. And we know what insufficient diaper supply does. We know about parents that are forced to recycle disposable diapers. We know of the health risks. We know of all of it. I just want to also say, extend my deep gratitude to all the advocates, all of the organizations that are here today testifying and who have sent testimony for this legislation. It is just so dire and so far reaching that we must do something as a Commonwealth. And so again, here to support these 2 bills, grateful to my colleagues, Pignatelli and Dom, and to the entire legislature and all the advocates who are testifying on behalf of this, and ask for positive consideration of this bill for this session. Thank you, and happy to answer any questions.
Thank you, Senator Lovely. Are there any questions? No, thank you so much.
Thank you.
Okay. Up next, we have Molly Hartford.
Hello. Thank you, Chair Livingstone and Chair Kennedy and the members of the committee for allowing me to speak today. My name is Molly Hartford. I am the Director of Development and Outreach at It Takes a Village, a small nonprofit in Western Mass that provides free postpartum support for families. One of our most impactful programs is our Village Closet Donation Center in Huntington, which provides families with free baby and children's clothing, essential supplies, and of course, diapers. There is no one way to solve a problem like diaper need. Every family and every community faces their own unique challenges. The barriers facing families in Hopkinton or Hamilton are not the same as the ones in Huntington. The Village Closet is the only diaper bank in the rural hill towns, and also the only diaper bank around here possibly the entire state, that delivers. Rural families face a huge geographic barrier to affordable diapers. Many of our clients are one vehicle families living in towns with zero transportation. This means when one partner is at work, the other partner can't exactly go to the big box store for discount diapers. The only option might be a more expensive gas station convenience store, if there even is one in their town. The mom and baby quarantining with COVID can't exactly go shopping. Neither can the survivor of intimate partner violence who's in hiding. So we deliver diapers. We have the systems in place to do it because that's what the families in our community need. The diaper bank in Pittsfield has a different system to meet the unique needs of that community, as does the diaper bank in Greenfield and the one in Worcester. The folks at these banks know what the need is in their community and how to meet it. They just need the resources to do it. This bill would allow the agencies speaking today, the ones best equipped to support young families in this state, to do the job well, to overcome the unique challenges facing their corner of the Commonwealth. This bill would ensure that all Massachusetts families have equitable access to diapers and to the vital local support they need to give their babies the very best start in life. Thank you so much for your support of this essential legislation. Thank you.
Thank you so much. Are there any questions? No, oh, thank you. Next we have Lev Ben Ezra.
Hi. Sorry, one moment. There we go. Good morning, and thank you so much for the opportunity to speak. My name is Lev Ben Ezra, and I'm honored to serve as the Executive Director of the Amherst Survival Center. Today, I will be testifying in strong support of House 149, an act establishing a diaper benefits pilot program, which seeks to provide grants to organizations like ours to help low-income households access this very basic and often overlooked necessity of diapers. I would also like to express my support for House 135, an act establishing basic needs for Massachusetts immigrant families, House 144 to lift kids out of deep poverty, and House 150 regarding the HIP program. The Amherst Survival Center is a vital resource in Western Massachusetts. Last year alone, we provided significant assistance to 8,600 area residents, including food, clothing, healthcare, and community connection. Within the food pantry that we operate, we go beyond providing just groceries. We provide essential toiletries, household items, and diapers. Many of us who are parents know the wonderful children's book, Everybody Poops. And alas, anyone who has ever been responsible for diapering the baby really feels this in their bones. Everybody poops. As others have shared, almost half of families struggle to afford enough diapers to keep their little ones clean, dry, and healthy. And this means that caregivers are making impossible choices. The Amherst Survival Center's standard food pantry diaper allocation is to give 40 diapers each month per child. It's not enough, but it is a really big help to families. However, I am really sad to share that our supply has been so low for the last many months that we've had to reduce this to 20 diapers per child per month, nowhere near enough for struggling families. My colleagues and I all have heartbreaking stories to share of a parent who's skipping their own meals so that they can provide for their children, including diapering their wee ones, or doctors in our medical clinic who are treating severe diaper rash from a child wearing wet diapers for too long. We rely mostly on individual donations and the United Way Diaper Bank to stock our diaper shelves, but do not have sufficient resources to meet even our basic diaper allocation of 40 per month. And this bill would provide resources, whether through the United Way Diaper Bank or to us directly, to meet that need. I see this bill not only as an act of compassion, but as a strategic investment in the future of our state. By ensuring that families have access to this basic necessity, we make it possible for parents to work, to attend school, and pursue opportunities that lead to greater economic stability, and for children to benefit from improved health, greater educational opportunities, and a brighter future. Thank you
Thank
for your
you.
consideration.
Thank you so much for your testimony. Are there any questions? No, thank you so much. Okay, we're going to move on to in-person testimony on these bills. First, we have Rachel Segaloff.
Good morning, Chair Livingstone and Chair Kennedy and members of the committee. My name is Rachel Segaloff, and I'm the founder of Beantown Baby Diaper Bank in Lexington, Massachusetts. Thank you for the time to speak today in strong support of Senate Bill 104, House Bill 149, and House Bill 225. I first learned about diaper need in 2012 after the birth of my second child. I stumbled upon Diaper Depot, a diaper pantry run by a Waltham church. Upon learning that they distributed 4,000 to 5,000 diapers to over 100 Waltham families per month, and that there was no current direct government assistance to help pay for diapers, I felt compelled to take action. I couldn't fathom worrying about whether I could afford to change my baby's diaper when she needed it. I couldn't fathom my baby remaining in a soiled diaper for a prolonged period of time, putting her health at risk. While I have been running diaper drives since 2012, I incorporated as a nonprofit Beantown Baby Diaper Bank in 2018. We currently serve 8 partner organizations based in Waltham, Burlington, and Lexington. The need for diapers has doubled over the past couple years. Before the pandemic, we provided approximately 60,000 diapers per year. Since 2021, we have distributed approximately 120,000 diapers per year to approximately 300 unduplicated families. In 2022, Beantown Babies spent about $10,000 to purchase diapers, which was about 25% of the diapers distributed. In 2023, the projected budget for diaper purchases is over $19,000 by year end, accounting for 50% of the diapers that will be distributed. Let me share a few firsthand accounts from families as to why receiving diapers is so important. It frees up money to buy healthy food and not have to count out the number of diapers I use per day. There isn't much left after rent, food, utilities, and gas. Receiving diapers has been a godsend. Another person said, we fall just short of being able to have help and services, yet we are living from paycheck to paycheck. The help we have received in the form of diapers has been life-changing. H149, S104, and H225 are critical to enabling diaper banks like Beantown Baby to continue meeting the community's increased diaper needs. I urge you to support these bills because every baby deserves to be healthy, clean, and dry. Thank you again for the time and opportunity to speak today.
Thank you so much. Any questions? No. Thank you for your testimony. Up next, we have a panel of Sarah Galvin and Brenda Jaron.
Good afternoon, Chair Kennedy and Chair Livingston and members of the committee. My name is Sarah Galvin. I am the founder and executive director of Marie's Mission Diaper Outreach Program in Worcester, Mass. Thank you for allowing me the time to speak today in strong support of Senate Bill 104, House Bill 149, and House Bill 225. Marie's Mission is the only member of the National Diaper Bank Network in Central Massachusetts, and we are an all-volunteer organization. We provide diapers to Worcester and the surrounding towns at our 2 distribution sites in Worcester, as well as providing diapers to other community agencies to distribute to those in need. We currently serve approximately 125 families per month, providing approximately 280 packages of diapers to those families. Each of our packages contains 50 diapers, which is 14,000 diapers a month and a monthly cost of over $3,500 in diapers alone. In the 8.5 years that Marie's Mission has been in existence, we have been a consistent and growing presence in the Worcester community. We have partnered with various community agencies to make sure that those we serve get their needs met. Marie's Mission operated throughout the pandemic without missing a single distribution day, even if it meant standing outside in the snow, delivering diapers as they drove through our parking lot. Those we serve value the support that we provide, not only through the diapers we hand out, but by always being there. Making sure that we meet the needs of the people we serve has always been integral to our mission, which is why when we formed our board of directors in 2018, we made sure to have one of our guests on the board. Unfortunately, that board member couldn't be with us today, but she did provide the following statement. To me, Marie's Mission is about keeping the memory of Marie alive through acts of service to babies. From the very beginning, my family has been welcomed and accepted for who we are with no question. We are a part of the mission in every aspect, just as we are. Starting just as a guest, but now having it be a normal part of our lives for almost 9 years now, I can say that I take a sense of pride in watching the mission grow and to serve so many families. Since Marie's Mission began, we have seen a steady increase in the number of families we serve every year. However, the last few months, we have seen an unprecedented growth. This year, we have added 158 families to those we already serve, 66 of those families since the beginning of August. With the Worcester area having seen a large influx of refugees, coupled with a continued overall increase of cost of diapers, we expect this number to continue to grow exponentially. Without adding any more new families, we are on track to distribute 1,100 more packages of diapers this year than we did last year. If this growth continues, over 1,600 additional packages will be distributed. Due to this growth, our operating budget has nearly doubled in the last year, and we are looking at least an additional $1,500 each month if this trend continues. Currently, 60% of our funding comes from individual donors, and with this continued growth, having additional funding sources has become necessary to not only meet the increased demand, but to sustain our program, which is why I ask for your support of Senate Bill 104, House Bill 149, and House Bill 225. Thank you.
Thank you, Chairman Kennedy and Chairman Livingstone and members of the committee for allowing me time to speak in support of Senate Bill 104, House Bill 149, and House Bill 225. My name is Brenda Guerin. I'm the board chair of Marie's Mission Diaper Program and volunteer at our distribution site in Worcester. Our mission is to ensure that families in need have an adequate supply of diapers to provide resources that promote healthy childhood development. Our community partners provide those resources: UMass medical students, Worcester Safe Baby Project, and Worcester Family Partnership Literacy Program. Our moms receive information on oral hygiene, water safety, childhood literacy, and safe baby sleeping education. Our diaper program relies on the generosity of others, but the harsh fact is we are almost out of money. To date, we have spent $25,800, and our remaining balance for the year is $5,500. In July, we stocked up with a bulk order through the National Diaper Bank, but this won't last long because of the increase. That bulk order is approximately the same amount that we spent in 2022. Recently, I received a request to discuss helping new undocumented families coming to Worcester who cannot access any cash benefits. And this need will be immediate, and we never turn anyone away, but we may not be able to keep up with that demand. As I conclude, my personal connection to Marie's Mission began 8 years ago, supporting my friend Sarah and colleague in honoring Marie's memory. But for Sarah, Marie's Mission is a labor of love. I respectfully ask for your support of these bills so we can continue Marie's legacy of helping the little ones who need us. And our motto is, there is no foot too small that it cannot leave an imprint on the world. Thank you for your time.
Thank you so much, and thank you for caring for the littlest ones in Worcester. I appreciate that. Any questions? Thank you both so much. Okay. I'm going to welcome our colleagues, Representatives Cataldo and Owens. I believe you're coming up as a panel, or?
Great, Chair Kennedy, Chair Livingstone, members of the committee, thank you so much for taking us out of turn today. We are here in support of H209 S125, an act providing for diaper changing stations in public buildings and accommodations. My youngest is not quite a decade out of diapers, but I do know that that Chair Livingstone has children closer to that. And and you'll be hearing from my colleague Rep. Cataldo about his more recent experiences. But I vividly remember the challenges of trying to find a changing station as a dad. It is very rare then to find a changing table in a men's restroom. The message is very clear. Dads are not expected to take care of children. Childcare is women's work. So why would a man ever need to change a diaper? Certainly not outside the home. So even worse is when there's no changing setup available to anyone. I know every parent has that story of trying to change a diaper on the floor or next to the sink or some weird, potentially unsanitary configuration. Parents all know how difficult it is to leave the house with an infant or toddler in the first place. What this legislation will do is to make it clear that parents and small children are welcome in the Commonwealth's public spaces. This legislation requires that all public buildings will install and maintain at least one private diaper changing station accessible to any caretaker regardless of gender or disability. Apart from any substantial renovation or remodeling, it will not require any retrofitting of existing spaces. It's only new public buildings that are constructed on or after the effective date. The cost ranges from about $1,000 to $1,500 installed, maybe a little bit more with inflation. Does not place a heavy burden though on construction cost finances. And over the past few years, many places are moving towards any gender or gender neutral restrooms anyway. So this requirement will make sure that parents of all genders are not left out of these accommodations as we go forward. By providing changing stations that are accessible to all caretakers, regardless of their sex, gender, or disability, we can make it easier for everyone to keep their children clean and healthy, and all parents can understand why this bill is important. It's a very small step that we can take to ensure that childcare is more accessible to everyone. So I respectfully urge the committee to report this bill out favorably, and I'm going to pass it to my colleague, Rep. Cataldo.
Mr. Chairman, Madam Chair, members of the committee, thank you so much for this opportunity to testify. It is wonderful to talk about diapers in an adult setting. Diapers are a big part of my life right now. I've changed several today and will change several more later on. We have 3 very little sons, one of whom is out of diapers, one of whom is thoroughly in diapers, and one of whom is in between, which is a very fun stage if you're not familiar with it. The reality is right now that dads, moms, all sorts of caretakers take care of kids, right? It's not 1970. I take my kids out of the house when they're babies, when they're 3, when they're 5, together. And sometimes my wife is with me and sometimes it's just me on my own. One of our favorite things to do on weekend mornings is to patronize any of the wonderful diners in our community near Acton or Concord, Carlisle and Chelmsford. And I guess I just put it this way. If you're going to be the next person in our booth, would you want a changing station to be at that restaurant, or would you want me to have taken care of that situation in the booth? I think we all know what the answer is. So this is a parenting issue. It is an inclusiveness issue. It's an equity issue. It's also a public health issue. And I think that what this law does is simply put into the MGL what we all know to be true, which is that all parents in 2023 and moving forward take care of their kids and sometimes take their kids out of the house to public places on their own. Thank you so much for the opportunity. I urge you to report the bill out favorably, as you have done a couple of times now. Thank you.
Thank you, representatives. Any questions?
Thank you very much to my colleagues. Laudable goal. I think it's absolutely essential. Had you considered adding adult changing stations as well, knowing fully that as we encourage adults with disabilities to be integrated more and more into the community, I'm imagining that adults who are disabled in many instances have the same difficulties that we would have with young children whose diapers need changing as well.
So I do know that there is another bill on adult changing stations, and this is a separate part of that, but would happily combine the two efforts.
Yeah, thank you very much. I thought I'd seen that somewhere. Thank you.
Thank you so much.
Thank you.
Okay. We're next going to move on to House Bill 150, Senate Bill 85, an act relative to agricultural healthy incentives program. We're going to begin with individuals in person on this bill, and I'd welcome up Rebecca Miller.
Good afternoon. So as you said, my name is Rebecca Miller. I work for the Mass Food System Collaborative. For the last 5 years or so, I've been lucky enough to work on the advocacy for the Healthy Incentives Program. So we're here once again in strong support of House Bill 150, Senate Bill 85, an act relative to an agricultural healthy incentives program. I believe this is the 4th session that this bill has been introduced, and this committee has been very supportive in the past. So we once again ask respectfully for this bill to be passed out with a favorable report. So as folks might know, the HIP program provides a dollar-for-dollar match up to a monthly limit dependent on your SNAP household size for SNAP dollars spent on fruits and vegetables purchased at participating farmers markets, farm stands, mobile markets, and community-supported agriculture programs across the Commonwealth. This is a no-cost bill. It would simply codify the program in statute and create a trust fund that operated for the first 3 years of the program that would be able to accept public and private funding. I can give you a lot of data on the HIP program, but I will try to be brief. So the impact of the HIP program since 2017, when it launched, has been extremely significant. SNAP recipients have purchased more than $53 million of produce from local farmers, earning back an equal amount of incentives in the process. According to DTA's data, more than 200,000 households have participated in the program, representing more than 300,000 individuals. In a recent month, 54% of the households that have used the program included a senior, 23% include a child, and 35% include a person with a disability. The program's success, as another person mentioned earlier, through the Children's Health Watch study that came out a couple of years ago, also means annual savings of millions of dollars in public health costs due to reductions in chronic disease and medical costs brought about by healthy eating. For every dollar spent on purchasing produce directly from a Massachusetts farmer, an additional $2 in local economic activity is generated, meaning HIP has stimulated at least another $106 million in financial transactions in the Commonwealth. And for the 255 farmer vendors participating in HIP, this $53 million in increased sales has made it possible for them to hire more staff, including multilingual staff that serve all of our communities, purchase goods and services from local businesses, and employ sustainable management practices that protect farmland. So that's enough statistics. I also deeply believe, as Rep already mentioned, in power of stories. So one of our farmers who, her name is Danielle, she farms in the city of Boston in the Nubian Square neighborhood. She was unable to be here today, but she wanted to share this note with you. And I believe she emailed this into the committee as well. Our Boston farm is oriented around production for farmers markets in underserved neighborhoods, and the HIP program has had a tremendous impact on our ability to ensure that many of our most vulnerable residents are able to access the foods at our market. While 37% of households in our neighborhood receive SNAP, and despite the fact that we price our vegetables at below market value and we're one of the first markets in Massachusetts to accept SNAP, it took years to build awareness amongst SNAP users that they could use their cards at farmers markets. It has only been with the introduction of HIP that we've really seen this category of shoppers grow. And just because of time restrictions, I'll say that there have been a number, basically countless numbers of folks who have told me over the years that HIP has led them to, introduce their children to new vegetables or reduce their medication or just be able to make culturally important dishes to them over the years. And we ask you to, again, report this favorably out of committee. And sorry for going over time.
Thank you so much. I appreciate that. And again, I appreciate that your testimony. Any questions? Thank you so much. And again, I appreciate that everyone has a lot that they want to share. And unfortunately, given the number of individuals signed up to testify, we have limited time, but I would ask, again, remind folks to please speak slow so that slowly so that our ASL interpreters are able to capture and translate accordingly everyone's testimony. And I promise I've already read the testimony that's come in ahead of time, and we certainly do take the time to read all testimony that is submitted to us, any written testimony. So thank you so much. Up next, we have a panel, James Lehner and Shannon Hickey.
Good afternoon, and thank you so much for your time and attention in considering an act relative to an agricultural healthy incentives program. I'm Shannon Hickey. I'm the program manager for CMAP, the Southeastern Massachusetts Agricultural Partnership. We are the buy local organization for Norfolk, Bristol, and Plymouth counties. We work with over 100 farmers in our region, communicate with consumers about local food and how to access it, and promote the region's 138 HIP access points. Through all this work, we know that HIP is incredibly valuable for the Commonwealth's food system. Farmers across the state rely on HIP for maintaining and improving their incomes. Especially in slower winter seasons, HIP allows farmers to keep employees year-round, as well as expand production and offer more crop variety. Many farmers are able to prioritize low-income neighborhoods year-round by utilizing HIP, bringing crucial access to local nutritious food for thousands of SNAP families in our region. Many farmers have built their business models on this new ability to equitably serve more communities. Stability for this program will not only help community members, as you've heard from Becca previously, and we'll hear in other testimony that you receive on this, I'm sure. But it will also keep money in the local food economy and strengthen hundreds of Massachusetts farm businesses. The stability lent by this bill will allow farmers to continue farming, contributing to regional food security, preserving farmland, and employing community members. I'd be remiss if I didn't also mention HIP's ability to build community and connect families to farmers. In addition to my work with CMAP, I'm a farmer's market worker for a HIP farm at the Roslindale Farmers Market, and I'm a HIP user myself. This program dramatically expands the number of Massachusetts families that can access local food. More than 1 million SNAP recipients in the Commonwealth are all eligible for HIP, and more than half of these SNAP households include children, disabled adults, or elderly folks. Farmers and farm workers themselves are also often HIP users. We've seen it firsthand as HIP becomes more popular, markets and farm stands become more welcoming community spaces, which has been especially crucial throughout an isolating pandemic. Now, in the face of potential federal SNAP cuts in the Farm Bill, HIP is all the more important. By increasing access to nutrient-dense local foods, HIP improves health outcomes and lowers healthcare costs. Increased consumption of healthy produce has proven impacts on health, especially for those with chronic illnesses, children, and elderly adults. We see this in the data, but we've also heard it directly from community members. Families' physical health, farmers' financial health, and our collective community health relies on HIP. Protecting it through support for this bill is really crucial.
Good afternoon, Chair Kennedy, Chair Livingston, and members of the committee. Thank you for taking the time to hear House Bill 150, Senate Bill 85. My name is James Lehner. I'm the Communications and Outreach Coordinator at CMAP. In my role, I work with our farmers markets, and community partners in increasing education, understanding, and usage of HIP across our region. We've 6 years of data now that show that definitively HIP helps families and farmers across the Commonwealth. DTA data that came out in this past June showed that $15.1 million in HIP incentives were used across the state in fiscal year 23. Nearly 30% more families used HIP in June of 2023 than did in June of 2022. The HIP eligible population of Massachusetts is growing, not shrinking, with new households joining every month. Similarly, New vendors are entering the program in communities all across the Commonwealth. Last year, DTA approved more than 100 new HIP access points, greatly increasing the reach of the program and access to healthy local foods. These new vendors, their farms, their farmers markets, their aggregators and food hubs, all now more capable of serving their neighbors and communities. And on top of this group, we hear from so many more farmers and folks like them who want to be a part of this program. The demand is on both sides, not just to use it, but to participate and help folks and help their communities. Despite this clearly demonstrated impact, the program is still only reaching a fraction of the people it could serve. In Bristol County, only 2% of eligible households are using their HIP incentives. That number is 4% in Plymouth County and 7% in Norfolk County. As the need for HIP grows, so too should its reach, something only possible by ensuring the program's long-term existence. Enacting this legislation will support its continued growth, allowing for more farms and families to participate in and benefit from the program. Every year the HIP is not enacted as a state law threatens the long-term viability of a deeply impactful program. This means that every year, families in need are left in real uncertainty about whether or not they'll be able to use the program, and farms risk potentially losing not only revenue, but an ability to serve their neighbors. This legislation establishes a Massachusetts Healthy Incentives Fund, which resolves much of the instability in the program that currently exists as it goes through every budget cycle, threatened every year to year and cycle to cycle. As we clearly see today, the Healthy Incentives Program is a critical piece of ensuring every family in Massachusetts has access to healthy, nutritious foods and enables farmers across the state to better serve their communities while still making a living and keeping their farm businesses alive. We respectfully ask that you report this bill favorably out of committee. Thank you for your time and consideration, and we'll be submitting written testimony later this week as well.
Excellent. Thank you so much. Do you have any questions? Thank you so much for your testimony. Okay, up next, I'm welcome Shauna Weaver. Shauna Weaver.
Hi, I'm here virtually.
Oh, okay. Go right ahead.
Hi, thank you, Chairs Kennedy and Livingstone and members of the committee. My name is Shauna Weaver. I'm the Managing Director of Fresh Truck, a program of the nonprofit organization About Fresh in Boston. I'm speaking today in support of H-150 S-85, an act relative to the Agricultural Healthy Incentives Program. I have submitted written testimony, so I will be brief. Fresh Truck is a mobile market that sells fresh, high-quality fruits and vegetables at affordable prices in neighborhoods that lack easy access to affordable fresh produce and have a high density of SNAP recipients. Fresh Truck is a HIP vendor, meaning that people are able to use their HIP incentives at our markets. We have seen an increase in the use of HIP at our markets as the pandemic era SNAP emergency allotment benefits have sunsetted. Currently, we see approximately 1,000 shoppers every week who receive an average of $30,000 worth of produce, 92% of which is HIP enabled. Shoppers report to our market managers that they are having to make difficult choices in order to make sure that they have enough food each month to feed their families. The availability of HIP benefits means that families have $40, $60, or $80 in addition to their SNAP benefits to spend on local fresh produce every month. Recently, I met a young woman at our Villa Victoria market in the South End neighborhood of Boston. We discussed the Healthy Incentive Program and where she could use it. She teared up when she learned that because of her household size, she had access to $80 of additional benefits to purchase worth of fruits and vegetables at local mobile markets or farmers markets each month. This additional healthy produce meant an incredible deal to her. At any market that I'm at, I speak with shoppers who are so grateful to be able to use their HIP incentives at our market and at farmers markets in the neighborhoods and throughout the Commonwealth. This incentive adds dollars to the household food budgets for people who have SNAP benefits. It keeps the dollars in Massachusetts, supports small farms, and supports the overall health of the food system in our communities. And I urge the committee to report in favor of this bill. I'd also like to add that About Fresh supports H-135 and H-144 as well. Thank you.
Thank you for your testimony. Do we have any questions? Thank you so much. At this point, we will welcome our colleague, Senator Timilty, to offer testimony.
Thank you very much, Chair Kennedy, Chair Livingstone, distinguished members of the committee. I am here today before you to testify in favor of two bills which I have filed. Senate Bill 127, an act relative to establishing an emergency food assistance committee, and Senate Bill 128, a resolve establishing a commission to study childhood hunger in Norfolk County as a result of the COVID-19 pandemic. Sadly, as we're all well aware, and painfully so, the COVID-19 pandemic exacerbated food insecurity as a result of increased unemployment and financial hardship. According to a May 2021 Greater Boston Food Bank report, food insecurity in Massachusetts rose by 55% during the pandemic. Additionally, according to Feeding America, Norfolk County, where I hail from, childhood food insecurity rose by 163% from 2018 to 2020, which may seem surprising to a lot of folks, but it is true, and it's an indication of where we all headed as a Commonwealth, sadly so. Moreover, this is the highest percentage increase in childhood hunger in the United States during the pandemic. Thankfully, food banks and food pantries, as we're all well aware, continue to serve as essential resources for the citizens of the Commonwealth. Without our food banks, food pantries, and volunteers, I would say, we would find ourselves in very dire straits. I have filed both Senate Bill 127 and 128 in direct response to the issue of food insecurity. With the permission of Chair Kennedy and Chair Livingston, I will now address these points, if I may. First, this legislation establishes 128, a Senate Bill 128, a commission to study what led to the large increase in childhood hunger in Norfolk County during the pandemic, which I believe as a Commonwealth, we can learn an awful lot from that drastic increase in childhood hunger. The commission's representatives from the Commonwealth will include the Executive Office of Health and Human Services and the Departments of Public Health and Transitional Assistance, among others. Additionally, this commission includes a childhood nutrition expert and representatives from Project Bread, the Greater Boston Food Bank, Norfolk County, and a local food pantry. The commission is tasked with evaluating causes and generating solutions to eliminate childhood hunger, including methods for improving access in Norfolk County. Now, Senate Bill 127, which is an act relative to establishing an emergency food assistance committee, specifically in response to the COVID-19 pandemic. The Baker administration convened the Food Security Task Force under the COVID-19 Command Center. This public and private partnership was tasked with responding to the increased demands for food assistance and disruption of food supply chains. As such, this task force inspired myself to file Senate Bill 127, which establishes a permanent emergency food assistance committee under the Department of Agriculture. While an emergency food assistance program has existed since 1995, this language codifies a committee, lists required members of the committee, and establishes annual reporting requirements. To be precise, members will include representatives from the Executive Office of Energy and Environmental Affairs and the Departments of Agriculture, Resources, Public Health, Transitional Assistance, and DESE. Additionally, the committee will include members from all food banks, Project Bread, the Coalition to End Hunger, and representatives from food banks and food pantries in each county. Furthermore, the governor's appointees must include experts in food access, childhood hunger, and representatives from the local boards of health. In short, the goal of this legislation is to ensure that all partners in the Commonwealth, including state and private nonprofit groups, are working together to combat hunger, and that we are evaluating and improving our resources. In addition to providing financial assistance, we must evaluate systems to ensure that they are meeting the standards of our constituents. We will be able to learn from the experiences of the COVID-19 Food Security Task Force. I'm confident of that. Thus, I recommend that the committee seek feedback from those members to learn about their experiences and to incorporate this feedback into legislation. Therefore, in this session, it's my belief that we must enact a comprehensive plan to ensure that individuals experiencing food insecurity have sufficient access and awareness of food resources in the Commonwealth. Moreover, a comprehensive plan will include studying the causes, gaining feedback from a variety of learned experiences during the pandemic, and codifying a system to ensure that this spike in food insecurity never happens again. With that, Chair Kennedy and Chair Livingston and members of the committee, I look forward to working with you on this legislation. And I am more than happy to obviously answer any questions and respectfully request ultimately a favorable report. Thank you.
Thank you, Senator Timilty. Any questions? Okay.
Good afternoon, Senator Timilty. It's nice to see you.
Good afternoon, Representative Doherty. It's always nice to see you as well.
I have taken a look at the summary. Thank you. I've listened to your testimony, of course, and the summaries, and have read the summaries to both bills. And a great concern about food insecurity, particularly among our children. So I'm just wondering, why just Norfolk County? What special circumstance has existed during the pandemic in Norfolk County that wouldn't be the same across the Commonwealth?
Well, thank you for the question, Representative. I tried to allude to that during my remarks, and I was not eloquent enough, so I apologize for that. But the increase of 163% between 2018 and 2020, thinking of the last time the Red Sox won, the first time the Red Sox won a World Series. But the increase dramatically so between 2018 and 2020 of 163% amongst children for food insecurity led the nation. So that got my attention very quickly. And I thought, given that that led the nation, it might be a great starting point in terms of what happened in Norfolk County, because quite simply and tragically, that was the leading increase in the entire United States of America. So quite simply, that's the reason.
Do you have any comparative data for the other counties? I'm sure that exists somewhere. I'd just be interested in my own county, for example, what that data might be.
Actually, we do have it in my office, and I will forward that along as soon as I get back to the office.
Thank you.
But quite simply, as far as Norfolk County goes, I just thought that was striking. The fact that Norfolk County led the entire nation in a statistic that is, we'll all agree, tragic and horrible with childhood food insecurity. I thought that would be a great starting point.
Yeah, thank you very much, Senator.
Thank you, Representative.
Thank you so much, Senator.
Chair Kennedy, Chair Livingston, members of the committee, thank you very much.
Thank you. Okay. We're going to return to virtual testimony, and I'll welcome Liz Ogilvy.
Good morning. Thank you, everyone who has made it possible for me to be here to speak to you. I especially want to send thanks to Senator Comerford and Rep. Dome, who have championed HIP for nearly as long as I have. I think I can say I'm the oldest HIP advocate, both chronologically as old, and have been doing it for as long as anyone, because HIP was actually piloted in Hampden County in 2011 with a food insecurity nutrition incentive from the USDA. My son thinks HIP is the sister that he hasn't met, and urban agriculture is the little brother he doesn't know. Everyone is giving you lots of facts, and I will do so in written testimony. Today, I just need to be your constituent and your neighbor. Omi from Mass Public Health Association noted that zip codes often determine our life expectancy. As far as food-related preventable diseases, COVID proved that to be true. We lost 2,800 people in Hampden County during the pandemic. 86% of those had underlying food-related preventable diseases. Quite literally, if HIP had existed 20 years ago, we might still have some of those people amongst us. And I need HIP to become permanent so that we are prepared for the next time. We all had food insecurity in all of our communities across the Commonwealth, and HIP literally saved the lives of some people and continues to every single day. I lead the Springfield Food Policy Council and Gardening a Community. We are two of the largest Black-led organizations working on food insecurity. GTC is 21 years old, and the Food Policy Council is 13 years old. We championed HIP for such a long time, initially because we understood its ability to mitigate hunger, and not just hunger, but access to fresh food. We continue to champion it even more vigorously after we realized that what we had been saying for a long time, that unhealthy food was killing people. There are 10 McDonald's within 1.75 miles of my house. 3 elementary schools in my neighborhood can see a McDonald's, and there is only one fixed year-round location that they can use their HIP benefits and their families. Families say, it's wonderful that you're teaching our kids how to eat healthy. I need to be able to buy the food. That's what I most need you to hear from me, is that HIP is going to save lives, and it's not a choice between HIP and all of the other poverty-related, so important, so vital legislation that people have championed so aggressively today. Hearing someone say we're the second wealthiest state, and I would remind us a commonwealth responsible for each other in this country, tells me you can do it all. Your goodwill tells me you will do it all. I'm counting on you. My birthday is in September. I need this as a birthday present. Please pass HIP and all of this other important legislation respectfully. I'm so grateful. Thank you.
Thank you so much and happy early birthday. Thank you for your testimony. Any questions? Thank you so much. With that, we'll move on to Enrique Vargas Rivera.
Hello, members of the committee. My name is Enrique Vargas, Associate Director at Mill City Grows. I'm also representing the Community Food Partnership and a resident here in Lowell. I would like, again, thank you for the opportunity to testify here. So Mill City Grows is a food justice organization with a focus on food access. The main way we do it is through our mobile market, right? For a long time, we were the only HIP vendor here in Lowell and saw how much it really meant to our families and how much more they could afford, and how much they were purchasing high quality local produce that actually tied to their cultural diets. If you know Lowell, it's like super diverse city. So yeah, since 2017, we have advocated for HIP because when the program stops, it drives people away from our farmers markets, some of which don't return. And at this point, we actually cannot imagine a world without HIP. So it doesn't not only help the people who otherwise wouldn't be able to afford the fresh local foods, but also supports the farmers who are growing them and vendors that we work with, right? So HIP is not only an economic driver for our mobile market, but also to the local vendors we work with. And is also an economic driver to those families who receive the benefit. The more income for local growers, and also it's pretty much more income for the families that receive the SNAP benefits. And a cool story. So like at one of our markets, we had a young mother and she was like really excited to just see the market. And we asked her if she had SNAP benefits, which she said yes. We explained her the HIP and she was all over the roof, you know. She told us she had 3 kids that love veggies and all that, and then bought a bunch of produce and everything. And a couple of weeks later, she came to the market and one of the kids had like a little toy shopping cart, you know. So it's moments like this that like set a precedent for people to like, you know, buy healthy food and make it a part of their habits, right? And with that, we also run a CSA where people can use their HIP, and that runs every week throughout the summer and every other week in the winter. This summer only, like over 50% of our participants use HIP. Many of them are elderly, disabled, lack transportation to the farmers market, sometimes all of them combined, right? As a nonprofit, we can fundraise for the delivery program that we run for the CSA because we bring it to them. But the HIP actually allows these people to actually access this produce. And a lot of these participants have told us like it really helps their health and it has improved the health. But also it helped us realize there's a whole market of people and group of people that just cannot even access HIP because, you know, like all the things I previously said. And we say like food is medicine, but it is only if you can get healthy food. And HIP is putting that food in people's hands who need it the most. Knowing that agriculture industry is super subsidized all across the board, HIP is like the smartest food subsidy that actually exists because it actually subsidizes like the people who are getting the vegetables, but also those farmers. And thank you.
Thank you so much for your testimony. Any questions? No. Thank you again so much. Okay, we're going to move on to House Bill 167, an act to provide a pilot program for low-interest loans to families with a child suffering from a terminal illness. We don't have anyone signed up for that bill. Moving on to House 168, an act establishing the Employability Task Force. We don't have anyone signed up for that either. And House 169, an act relative to education or training activities for purposes of meeting the Department of Transitional Assistance work requirement. We don't have anyone to signed up for that. So next we'll move on to House Bill 172, an act to enhance hospital care for those with autism and intellectual and developmental disabilities. We'll start this one with those who have signed up virtually, and I have Elise Levine Kanji as the first person to testify. Elise, you can go ahead.
Yeah, thanks. I was trying to get my
camera on. Thank you very much, Chairs Kennedy and Livingstone and respected committee members. I'm testifying in support of House 172. This bill would make a significant health impact on the lives of so many people by training current hospital professionals in the best practices for treating people with intellectual and developmental disabilities, or IDD, including autism. I'm testifying as the mom of a wonderful 25-year-old young man who has autism, and on behalf of Advocates for Autism of Massachusetts, or AFAM. AFAM was formed in 2004 to be a statewide grassroots advocacy vehicle for people with autism, their families, and the professionals who support them. When my son Sam was diagnosed with autism in 2000, his pediatrician and most of the medical personnel we interacted with seemed to know very little about autism. In fact, a few years after Sam was diagnosed, his pediatrician called to ask me if he could give my name to other families with newly diagnosed children to share what I had learned. We've made progress since then, but House 172 could ensure that medical understanding of autism and IDD is more robust and widespread. This is essential given that autism research continues to evolve rapidly and that the number of people diagnosed with autism continues to increase. When Sam was diagnosed in 2000, the CDC estimated that 1 in 150 children had autism. That number has now grown to 1 in 36, or almost 28 of every 1,000 American children. A 2018 study found that children with autism were twice as likely as those with other disabilities to have unmet health care needs, and that nearly 20% of autistic children had gone without a needed medical or mental health service. By comparison, fewer than 10% of children with other types of disabilities, and just 2.6% of those who are typically developing, missed out on such services. Clearly, if medical providers don't realize how autism may impact a person's presentation or ability to communicate, they may be less able to treat the non-autism related medical issue, leading to worse health outcomes for autistic patients. Our community is thrilled and grateful that the Commonwealth's fiscal 24 budget recognized the importance of training students in the medical profession about autism and IDD through funding the ARC's Operation House Call program. However, we need to ensure that current hospital professionals also receive that training. For these reasons and more, I respectfully urge you to report favorably House 172 out of committee as soon as possible. Thank you very much for your consideration and for the important work you do every day to improve the lives of people in the Commonwealth.
Thank you for your testimony. No, thank you so much. Moving to people who signed up in person. First, welcome Mara Sullivan. Are you?
Good afternoon, chairs and members of the Joint Committee. Thank you for your time. I'm Mara Sullivan, and I'm the Director of Government Affairs and Health Policy for the ARC of Massachusetts. I'm here today to testify for H172, the hospital training bill that you just heard from, and also H212, universal changing tables, because some of us are still changing diapers. So for the last 13 years at the ARC, I've been training thousands of medical students. This section, as you heard from Elise, our bill was codified. So thank you for the support on that. But this gap in hospital training causes traumatic situations, disparate care, misdiagnoses, even death. The Institute of Medicine deemed a lack of provider education as one of the greatest barriers faced by this population. This bill creates standards of care for patients with autism, requires continuing ed credits, and will help prevent situations like I've experienced with my two sons. In an ER, my nonverbal son wasn't given a hands-on exam. Our desperate communications were ignored, and he was discharged. But Neil made it clear that he was in trouble. We refused to leave, and his appendix ruptured. He ended up in surgery with complications. Research shows that 60% of doctors do not feel equipped to treat patients with autism or IDD. You heard from Rep. Garbely last February, Daniel Donovan was treated at a local hospital. Clearly not understanding anything about his needs relative to autism, he was discharged without contacting any supports. Daniel wandered from the hospital and was found dead from exposure in nearby woods. This is devastating and totally preventable. This is Daniel and his mom's testimony. Turning quickly to universal changing tables H212, there's been an unacceptable oversight of the toileting needs of those in our community who are bigger than toddlers. Like many living with profound autism, my boys were almost as big as me when they still needed changing. I was squeezing them into the back of my car or laying them on dirty bathroom floors. It was impossibly hard on us and unsafe. This bill requires new construction and remodeling to include a universal changing table in public buildings. We've built an incredible coalition, which you'll hear from later. And there's no cost attached to the bill, but it will take time for the law to make an impact, and we can't afford to delay. So these bills are personal and they are vital to our community, and we humbly come to you. Thank you for listening.
Thank you for your testimony. Any questions? Thank you so much. Next, we have Judith Ursity. Judith? No? Okay. Up next, Jonathan Gardner.
There we go. Hello, chairs and members of Children's and Families. Thank you for the opportunity to testify in support of hospital training to enhance healthcare for people with autism and IDD H172. My name is Jonathan Garner. I'm a 20-year-old self-advocate, cancer survivor, and decision maker who happens to have autism. I live in East Bridgewater. This bill is very important to me because I experienced a lot of different situations before, during, and after my cancer diagnosis. On my journey to find out that I had cancer, I had to endure 3 MRIs, all because the technicians doing the MRIs kept saying to me, it must be the loud noises, and that is why you can't sit still for the test. When I kept telling them it was my back that was painful, they kept dismissing it. I was told to take Ativan, which is an anxiety medicine, as it will calm me down because they said the noise and sounds that were bothering me because of my autism, even though I was communicating with them, the technicians myself, they just assumed I was anxious and had sensory overload without listening to what I was actually saying. With my mom's support, I was able to advocate to be sedated for my MRI when I was diagnosed with Ewing sarcoma, which is a rare form of fast-growing cancer that spreads quickly. More recently, in March, my mom got a phone call from the clinic that was going to perform an endoscopy on me. My mom was told my endoscopy to be rescheduled at a hospital, and it could take a few months for this to happen. My mom asked why, and she was told Jonathan's autistic and his behaviors are concerning to us, so therefore he would need to be done at South Shore Hospital, which may not take until sometime this summer. When asked what behaviors I had, she was told, I'm not sure what particular behaviors, but Jonathan does not fit the criteria of our center, and we need to keep the staff and Jonathan safe, and that is why this cannot be done here. The doctor that recommended the endoscopy at this clinic wrote in his personal notes on my medical portal that I was a pleasant young gentleman. I want to add that if I did have challenging behaviors or was not polite in the office, I still deserve to have a procedure that could be diagnostically important to my wellness and quality of life, and should not have to wait months for care. I ended up being denied health care because a nurse saw that I was autistic and assumed that I would would have some so-called behaviors that would make myself and others unsafe instead of getting to know me as a person and how best to communicate with me because of my disability. I feel so strongly that everyone deserves to have the healthcare they need and deserve. The hospital training bill will give healthcare professionals more tools to better understand the needs of patients like me. This training will result in better quality and more inclusive healthcare for everyone. Let's pass this bill and change the way people who happen to have disabilities are treated. All lives are worthy and matter. Thank you.
Thank you, Jonathan. I appreciate your testimony and I'm sorry to hear about the experience you went through, but thank you for coming here to testify to. Thank you so much.
Thank you.
Next, we're going to welcome up Paul Willenbrock.
Well, thank you. I appreciate you all being here. I'm going to stand up. My name is Paul Willenbrock, and my wife and I own a home in Beverly, 5 Clifford Avenue. And I am here today in favor of testifying in hospital training H172 and S1401. I will be happy to take any questions you have. I serve on 3 human rights committees serving the developmentally disabled and autistic and am a member of ARC. My wife and I are parents of 2 adults, one who teaches in middle school, Lynn, and Megan, who is autistic and severely developmentally disabled. Megan lives in a state-run group home, and we are very appreciative of that. We've heard of a lot of needs, but state-run group homes are the best. Remember it. When living with us in her early years, Megan was unable to get care from a primary care doctor or dentist. Finally, when she was placed for 2 years as a young adult in the Hogan Regional Stabilization Unit, she received dental care from the Tufts Medical Clinic located there. Years later, we convinced our primary care doctor to care for her, and that's working out. From my work on human rights committees for the IDD and autistic on the North Shore, it is very clear that not only doctors, but also dentists and other health care providers should be given training relating to effectively working with IDD and autistic community. Training should include accepting all people as human and showing patience and skills needed to serve human beings in the most effective way possible. I think the proposed Office of Health and Human Services state plan would be very helpful and required, and hopefully required not only of hospital-based workers, but also dentist health providers, regardless of where they provide services. And thank you for your time. And thank you for all you do. You've been sitting here for 3 hours, and it's great.
Thank you for your testimony and thank you for also sitting here to be able to provide your testimony for us. So thank you so much.
Thank you, Senator Kennedy.
You're welcome. Next, we're going to move on to House Bill 176, an acts relative to intellectual disabilities for DDS services. First, we only have individuals signed up to testify in person. So first we'll call up Paul Elmstrom.
Good afternoon. My name is Paul Elmstrom, father of Jacob and Olivia Elmstrom. My son Jacob, who's now 23, has a brain injury due to suffering meningoencephalitis with right hemiparesis at the age of 3.5. He is diagnosed with epilepsy, anxiety, depressive mood, language-based learning difficulties, and autism spectrum disorder with accompanying language and mild to moderate intellectual impairment. Jacob's profile is incredibly complex and has always been difficult to describe. Early in his education, Jacob's testing showed average strength and nonverbal skills that he could not access in a classroom environment given his verbal deficits and complex medical history. He was denied an IEP, stating that his challenges were medical and not educational. It did not take long for teachers to realize an IEP was necessary to support his needs, and this remained in place until 22 years of age. Given his complex profile, he went through 3 unexpected changes in schools, 1 in district and 2 out-of-district placements. The last placement that Jacob remained at for 5.5 years served less than 12 students diagnosed with learning, intellectual, cognitive, or developmental disabilities with no significant behavioral issues. This program was a benefit for Jacob given the one-to-one and small group instruction he received for academics and social emotional challenges he faced. During Jacob's transitional year, we sought an updated neuropsychological evaluation. Consistent with previous evaluators and evaluations, it documented that Jacob will require wraparound and intensive intervention services across his lifespan, which should be considered medically necessary. My wife and I did not need a report highlighting that Jacob will require intensive care throughout his lifespan. We live it every day, helping Jacob with his adult living skills and consistently trying to rephrase short sentences in response to Jacob's statement, "I don't know what that means." We have been Jacob's legal guardian since 2018 and have been discussing for years how to prepare for Jacob so that he will be cared for when we are gone. Given our daughter's own challenges with anxiety and depression, we could not, nor should we expect her to care for Jacob. While Jacob does qualify for DDS services under autism spectrum disorder, it is not enough to support his lifetime needs given his intellectual impairment. Other state programs do not fill this gap. While DDS has agreed that Jacob's challenges with adult living skills meet the criteria for DDS services under intellectual disability, they expressed his full-scale score just above 70 does not. His full-scale IQ score in the context of diagnosing intellectual disability must be interpreted in the context of a person's difficulties with general mental abilities. Moreover, scores on subtests can vary considerably so that the full-scale IQ score may not accurately reflect overall intellectual functioning. This is the case for Jacob. His subtest scores vary considerably. There is a clear disconnect between Jacob's scores and his ability to apply these skills in the real world, as shown as his educational journey as well.
Thank you. Thank you so much for your testimony.
You can submit written testimony, which is often more helpful to the committee.
Okay, where would I do that?
I'm gonna connect.
Does anyone have any questions?
I don't believe so.
There's cards outside with all of our emails that you can provide written testimony to.
All right, thank you.
Thank you. Up next, we have Dr. Drew Coleman.
Good afternoon, everyone. How are you? Dear members of the Joint Committee, first, I just want to thank the committee members for their time and consideration of the House Bill 176. I'm honored to be here in support of this act and also in support of children, adolescents, and adults and their families, whom we've just heard from, that would greatly benefit from this potential amendment, including many of my direct patients, one of those being Mr. Elmstrom, who you just heard from his family. As a quick background, my name is Drew Coleman, and I'm a PhD clinical psychologist, neuropsychologist, trained at the University of Miami and trained down the road here at Mass General Brigham, Harvard Medical School. I'm a faculty member there and director of a clinic there, as well as a founder of a private practice in Cambridge. My opinions expressed here are my own. I've been researching and conducting clinical work with individuals with neurodevelopmental conditions across the lifespan for over 2 decades, including those with autism, intellectual disabilities, and learning differences. Through that, I've developed expertise, comprehensive knowledge of neuropsychological assessment of neurodevelopmental conditions, as well as treatment planning. I also have a personal journey since my early childhood of watching family friends struggle to identify and to be able to access appropriate services for their loved ones. For those who don't know, neuropsych testing is a procedure that utilizes standardized tests comparing someone's performances on tests to a normative sample of their age mates, which allows us to estimate factors such as, but not limited to, intellectual functioning, academic skills, memory, executive functioning, social communication, emotional, as well as behavioral functioning. At the heart of this bill is a proposal for the Department of Developmental Service, which is an excellent and critical lifeline for many of those affected by neurodevelopmental conditions, to critique the eligibility criteria for services so that it more reflects what the science in my field emphasizes with our testing. That being, diagnoses and scores do not on a standalone basis define our patients or their profile of needs. As such, it's critical that determinations of accessing services is not simply made upon a review of one or even a few IQ scores, rather that the full neuropsychological profile of individuals is taken into consideration, including tests of their intelligence, but also their adaptive functioning, meaning their self-care independent skills. For example, it's not uncommon for individuals with autism to perform within normal limits or close to that in some prescribed specific areas of that testing. However, on the contrary, they exhibit significantly impaired adaptive functioning or self-care abilities. In other words, there can be a disconnect between aspects of somebody's intelligence measurements on testing and their ability to apply those skills in real life. So thank you for your consideration of this bill.
Thank you. And we welcome additional testimony submitted by written testimony. Thank you.
Appreciate it. Thanks so much.
Thank you. Okay, moving on to House Bill 184, an act relative to financial literacy. We don't have anyone signed up for that. House Bill 185, an act relative to the Healthy Incentives Program. We also don't have anyone signed up for that. Moving on to House Bill 187, Senate 117, an act to protect safety net access for Massachusetts residents. We have one person signed up online, Cheryl Smaltz. Do not believe is here. Okay, so we'll move on to House Bill 193, Senate 88, resolve providing for an investigation and study by a special commission relative to children and adolescents with intensive behavioral health needs. Don't have anyone signed up for that. House 197, Senate 99, an act creating a special commission to study the current refugee resettlement infrastructure and ensure the successful integration of refugees in Massachusetts. We have Amy Mitchell signed up to testify online. Okay. House Bill 199, act to let kids play. We don't have anyone signed up for that. House Bill 200, an act relative to the utilization of systemic alien verification for entitlements programmed by the Commonwealth. We don't have anyone signed up to testify for that. House Bill 205, Senate Bill 371, an act relative to assisting elders and people with disabilities in the Commonwealth. I believe I saw Kelly Turley here to testify in person. Welcome, Kelly.
Good afternoon. Thank you for this opportunity to testify on behalf of the Massachusetts Coalition for the Homeless in support of House Bill 205, Senate Bill 371, and two other bills that are key to improving the quality of life, upholding human dignity, and strengthening communities by better addressing the economic and nutritional needs of older adults, people with disabilities, children, parents, and immigrants. We urge you to give a swift and favorable report to H205, S371, an act relative to assisting elders and people with disabilities in the Commonwealth. This refiled bill from Rep. O'Day and Senator Jalen would make three critical changes to the emergency aid to the elderly, disabled, and children program. As we heard earlier, the grant levels are notoriously low. This bill would first increase the monthly grants to match the levels provided under the parallel TAFDC program for children and families based on household size. So that would mean for an individual, the monthly grant would increase from $401 a month now to $553 per month. Second, it would build in an annual cost of living adjustment, so if the grants wouldn't lose value year to year. This component is especially important as EAEDC participants are still recovering from grants being stagnant for 33 years. Between 1988 and 2021, the grants didn't increase at all. Third, this bill would permanently eliminate the homelessness penalty, which for decades unfairly slashed monthly benefits for EAEDC participants experiencing homelessness by 70%. We're grateful that similar language is in the FY24 budget, and we want to see this language in statute as well. Together, the changes included in this bill would positively impact the 28,000 older adults and people with disabilities participating in EADC and our larger communities. We also echo earlier testimony from our colleagues and ask you for your full support for H75, S144, an act to lift kids out of poverty, and H135, S76, an act establishing basic needs supports for Massachusetts immigrants. These three bills are timely and urgently needed as the Commonwealth simultaneously faces the family homelessness state of emergency, a dramatic rise in older adult homelessness, and skyrocketing rates of housing instability, both for newly arrived immigrants and longer-term Massachusetts residents. Together, these three bills will help tens of thousands of our neighbors achieve greater economic stability, food security, and housing stability, while also putting us on a path to a stronger, more welcoming, and more equitable Massachusetts. We hope that the committee takes this opportunity to unequivocally support these three bills. Thank you.
Thank you for your testimony. Up next, we have H210, an act relative to the use of electronic benefit transfer cards with regard to online grocery delivery services. We don't have anyone signed up for that. I did miss House 209, Senate 125, an act providing for diaper changing stations in public buildings and accommodations. We don't have anyone additional signed up for that. House 212, an act requiring universal changing station in public buildings. We have a list in person. Thank you for your patience. And we'll start with Jamie Betts.
Members of the Joint Committee, my name is Jamie Betts. I'm the founder of the Massachusetts chapter of the Changing Spaces campaign. I began this work after experiencing with my daughter Sophia the challenges that traditional handicap restrooms present to the many diaper wearers who can no longer utilize baby changing tables. On a national level, the Changing Spaces campaign is making progress. 5 states have either passed legislation, updated building codes, or established state-funded grant programs to facilitate more widespread adoption of tables. Many other states have legislation introduced. Changing Spaces leaders were part of a task group established by the International Code Council to develop code change and standardized specifications for the installation of tables. These changes are approved to be included in the 2024 International Building Code, and we will look to work with your committee staff to bring the language of H212 in line with those established specifications. I'll never forget my family's first encounter with the universal changing table in a companion care restroom at the Charlotte airport. For the first time, I was not forced to lay Sophia on a filthy floor in order to care for her. I did not have to worry about curious strangers watching her under the stall doors. I didn't need to wrestle on that floor myself, trying to minimize Sophia's exposure, as I have at times needed to do at Boston Logan, state and local parks, libraries, museums, rest stops, supermarkets, amusement parks, shopping malls, beaches, and zoos around Massachusetts. If it is truly important to us that people with disabilities are able to fully participate in the community, then we must recognize that the ADA does not go far enough by simply allowing access into buildings. We need to put equitable restrooms in place so that people can spend a reasonable amount of time away from home without being forced to sacrifice their privacy, safety, and dignity to meet the most basic need of toileting. No one should need to consider fasting before a day away from home in order to avoid an uncomfortable situation or risk infection by staying in a soiled diaper, or the most simple and devastating solution of all, just staying home. I never regret taking Sophia on an outing. I know that every experience furthers her development, and she deserves to participate in all the activities that her typically developing peers enjoy. But taking her out is hard work on a good day, and the lack of universal changing tables presents another barrier to entry, as we must also plan for how and where we will care for her safely. This experience becomes exponentially more difficult and traumatizing as individuals grow and become more aware that the best our society is willing to offer them is a bathroom floor. This bill is a step in the right direction. The cost to taxpayers will be minimal, given that the changes apply only to new buildings and substantial renovations. The cost of installing these tables are far outweighed by the social and economic benefits to our communities through the presence and engagement of disabled people, their families, and caregivers. I encourage the committee to vote positively on 212 and just as importantly, to continue to work toward widespread adoption of tables and a Commonwealth where all people have the opportunity to move around their community with comfort and dignity.
Thank you for your testimony.
Thank you. Thank you for being here all day.
Of course. Next, I have Karen Romano.
Good afternoon. If the need for universal changing tables never occurred to you, then you don't know my reality and the reality of so many others in the state. My son is 6 years old with complex special needs, and he's not toilet trained. He probably will never be toilet trained. My son's not here in person today because even in our state capitol in the state house, there is not a facility that will allow me to change him in a safe and dignified way. Families like mine are forced to make choices every day about where and how to travel through the Commonwealth in order to accommodate the very ordinary and basic needs of their loved one. Parks, museums, sporting facilities, libraries, public buildings and facilities throughout the state have handicap parking, ramp accessibility, handicap seating options, giving the impression that these facilities are accessible and inclusive and welcoming. But without providing access to a universal changing table, they might as well have a sign on the entrance that say disabled not welcome. The passing of this bill would be a step toward inclusion and equity for the disabled community in Massachusetts. The cost to the state is negligible. And for the businesses and the organizations, because this only applies to new construction and to major renovations, they can incorporate that into their construction plans from the beginning, mitigating those costs. I can remember being a child and going out with my mom and entering a public restroom and listening to her say, "Be quick and don't touch anything." And that memory comes back to me when I get on my hands and knees and put my son on the floor of a public restroom to change his diaper. We can do better. We have to do better. This bill would be a sign that this state values all of its citizens, regardless of ability. I hope that you can pass it forward, and I appreciate you taking the time to listen to us today.
Thank you. Representative O'Day.
Good afternoon. You folks just getting here? Thanks so much for taking me out of turn. But even beyond that, I thank you so much for all the work that you've been doing here today. I know it's been a long day. So I am going to be even briefer than I intended on being. I'm here in support of Bill 205, an act relative to assisting elders and people with disabilities in the Commonwealth. The chief sponsor, lead sponsor of that bill. It is a bill that I have been working on behalf of for, I think, for most of the past 10 to 12 years. And it is one that I think has a great benefit to those who are eligible to take, I don't want to say advantage, but those who are in low poverty would be helped by this bill. So I have submitted significant written testimony. I'm going to let that testimony stand, but wanted to at least show up in person to specify my strong support. And I hope that I can ask that the committee give it its full consideration and hopefully an ought to pass recommendation. Thank you.
Thank you, Representative.
Any questions?
We'll look forward to reading your written testimony. Thank you.
Thank you.
We know where to find you for follow-up. Up next, we have Amy Grady.
Hello, good afternoon. My name is Amy Grady. I'm the mother of two children. Connor is 5 and Claire is 4. My son Connor suffered a neurological injury at birth, which resulted in spastic quad CP, epilepsy, and him being 100% dependent on care. I'm testifying today in favor of Bill H-212, which would mandate universal changing tables in all newly constructed public buildings. This will allow for a truly inclusive Commonwealth. One of the most fulfilling parts of being a mother is witnessing my children explore our great state, learn, and grow together. As Connor gets older and bigger, we are experiencing the current barriers of accessibility here in Massachusetts. We have had to make our own accommodations when it comes to changing Connor. Unfortunately, today the options are between the public restroom floor or the back of our vehicle. Although both options give my son no dignity, it is this or Connor and our family are forced to go home. Safety, dignity, and life experiences should not be limited because of one's disability. A truly accessible Massachusetts would allow my children and so many others who love to visit and explore the ability to do so without the worry of a basic human need, using a restroom. The older my children get, the greater their barrier is becoming. It is separating the memories and experiences our family makes. We are asking ourselves, is it safer for Connor to stay home than to be out in his community? This is not a Massachusetts anyone deserves. I am asking you today to support Bill H-212. Having access to universal changing tables throughout Massachusetts will allow my family and so many others the ability to enjoy our communities without the worry of using a restroom. Thank you.
Thank you for your testimony. Up next, we have Marcy Randall.
Good afternoon. My name is Marcy Randall. I'm the parent of a medically complex 15-year-old boy. My son depends on a wheelchair for both mobility and support, and he's not able to use a toilet for hygiene and relies on incontinence briefs. He's currently over 4 feet tall and close to 80 pounds. The bigger he gets, the heavier and more unwieldy he gets. When we are out in the community and his brief needs to be changed, we either lay him down on the floor or seat of our vehicle or the floor of a public bathroom. If he has an appointment at a doctor's office or at the hospital, we have to wait until we can get into a private exam room to put him on the table in there. And sometimes they don't even want to let us do that. We have even changed him once or twice outdoors on the grass in a secluded area. Talk about being undignified. Not only is this dirty and a wonderful way to catch and spread germs, it's also a matter of privacy and safety. Our diaper bags are overflowing with adult-sized briefs, wipes, disposable gloves, disposable pads to lay underneath him, a cushion to lay underneath the pad, extra clothing that is much larger than baby clothes, and of course, trash bags to dispose of the waste wherever that might be. And hopefully we can find a bin instead of having to bring that home. These challenges make it very difficult to leave our home for long periods of time. There are so many wonderful things in our city and state that he does not get to experience. The lack of a dignified changing space prohibits true and realistic accommodations in our public spaces. I urge you to consider adding universal changing tables to the ADA rules of compliance. Thank you so much for your time and support.
Thank you for being here today. Thank you. Up next, we have R. Feynman.
Good afternoon, Chair Livingston, Chair Kennedy, and all the members of the committee who are left. Thank you for your time. My name is R. Feynman. I am the Senior Community Organizer at the Disability Policy Consortium, which is a statewide disability rights advocacy, policy, and research organization. I'm testifying today in support of Bill H-12, an act requiring universal changing stations in public buildings. And I'm also going to mention H-142, an act relative to community living for older adults and people with disabilities. We've heard a lot about kids, who are great, but also many disabled adults with a range of disabilities need help with aspects of self-care to maintain their independence, whether that's changing diapers, adjusting catheters, or assisting with other toileting needs. Currently, without changing stations to accommodate them while in public, adults with disabilities have to be changed in unsafe and undignified conditions, such as on bathroom floors. Baby changing tables cannot support adults. And even if they could, because they don't have adjustable heights, many caregivers wouldn't be able to get them onto them. Going hours without changing soiled absorbency products can lead to severe medical conditions, as you also heard about for babies, such as rashes, infections, and skin disintegration. Faced with the choice between this and getting changed on unsanitary bathroom floors, many people would rather just stay home, which severely limits their independence and ability to participate in the community. I'll just say, as a trans person, who has faced the decision between just not eating or drinking or being humiliated about bathrooms in public, it's really crummy. And the state has done a lot in that direction. And I think that it is a fair hope to hope that this direction will be addressed as well. H142 addresses a lot of key concerns of the disability community, many of which are covered in other bills that we've supported. Remote participation in public meetings has made a major difference in my ability to participate in civic life, and many others as well. In my work with the commissions on disability across the state, many of them have remarked on how remote participation has increased the accessibility of their meetings significantly, allowing people who are homebound to participate in their city government, or who just aren't feeling well that day. The legislation governing the Architectural Access Board has needed updates for a long time to make the state more welcoming. Okay, I will send the rest in writing. Thank you so much.
Thank you for your testimony. We look forward to the additional written testimony. Thank you. At this time, I'll welcome Senator Becca Rausch to testify.
Good afternoon, chairs. Good to see you. Thank you so much for taking my testimony and for taking me out of turn. I am here on Senate 125, an act providing for diaper changing stations in public buildings and accommodations. This is a bill I crafted and filed in my very first term in the legislature. And it was reported out favorably in that term. And then in the second term, Representative Owens came on as a House partner. And then this term, we had Representative Cataldo as well. I understand that you've heard from them already. So you already know the sort of content of the bill and the specter of it. But the short story is we just need some clean, reliable, accessible, equitably accessible spaces to change diapers. It's really just that simple. It's also really not that expensive. The bill is carefully crafted and narrowly tailored to basically ensure that those spaces are available in the same places where people who use a bathroom, people who know how to use a toilet, could find a bathroom to use. And these changing stations do not necessarily need to go into a bathroom, which is part of the accessibility and equitable component of the crafting of this bill. I will also just share that when I was first preparing this bill, I actually heard from someone, Chair Kennedy, who lives in your district, who said that when he was trying to change his daughter's diaper, he couldn't find anywhere to do so that was clean. So he changed her diaper on top of a bar. Not something I had personally done, but frankly, totally understood where he was coming from, because it's just that hard to find clean, reliable, equitably accessible places. So I again ask for a favorable report on this bill, and happy to answer any questions. Thank you so much.
Thank you. Appreciate your testimony today. Thank you so much. Up next, we have Mallory Brown. Okay, thank you. We have next Raquel Quezada.
Good afternoon, Senator Kennedy and Representative Livingstone, and member of the Joint Committee for Children, Family, and Person with Disability. Thank you so much for all the work that you guys doing. My name is Raquel Quesada. I live in Haverhill, and I'm proud mom of some we have developmental disability and diagnosed with cerebral palsy. Today, I'm testifying in support of the House Bill 212, enacting required universal changing station and public bathroom. I'm a citizen member of the Massachusetts Developmental Disability Council, NDDC, an independent agency dedicated to empower how do people with the developmental disability and their family to enjoy full productive life by promoting self-sufficiency, community inclusion, and opportunity. My son and other with disability should be able to access the public space in their community, and House Bill 212 will help ensure they have access to public restroom. My son Joan will be 18 years old in October. He weighed 140 pounds. Changing table station currently found in the bathroom today typically accommodate children up to 50 pounds. Due to his cerebral palsy, Joan will continue to require full physical support and adult with his activity daily living and inclusion in toileting. With this right support, Joan is living a meaningful and inclusive life. He loves being active and visiting and exploring park, theater, music, and other public spaces in our community with friends and family. During this week, as part of his public education, turn on the life, likely alive serving, Joan is also in the community on regular basis and visiting variety of public places. So he is preparing to live in the community as an adult. Access to the community is better for him and his life and meaningful and inclusive, like to both people with disability and without disability. Large adult large adult with disability like Joan have more difficult time being in the community because the public restaurant don't accommodate them. Joan using a stroller and universal change station will be making using public restroom more easy, more hygienic, and safety for him. Please support House Bill 212 because the legislation is an important step making our community more accessible to all citizens. Thank you so much.
Thank you for your testimony. Next, we're going to move to individuals who've signed up virtually to testify. First, we have Taylor Brisbane.
Hi, I'm here. I'm not sure if it's possible to get the video option.
Okay, go right ahead. We can hear you.
Okay, thank you. Thank you to the chairs and members of the committee. I am joining today to testify in support of H212. I originally am a pediatric school-based physical therapist, and now I'm a special education administrator. I come to this topic of universal changing tables when initially planning more accessible field trips to ensure that the students with multiple disabilities that I work with have access to those same experiences as their siblings and peers. However, when we started this process, it became evident quickly that the limiting factor of helping all of our students experience educational aspects off campus was a lack of accessible restrooms, specifically universal changing tables. And with this, I know field trips is just one aspect of community life, and you're hearing about many of the day-to-day aspects from families. And immediately our thoughts went to the families who are experiencing this on a daily and weekly level with their children. But today I wanted to talk a little bit more about incontinence and just the wide range of disabilities that can impact. Because when we talk about universal changing tables, we're really talking about the need for support of incontinence in the community. And this is not limited to really any age or disability group. Diagnoses that can impact continence and subsequently require supports for bathroom access can range from traumatic brain injuries, spinal cord injuries, neurological impairments, intellectual disabilities, and also aging disabilities, such as Alzheimer's and dementia. So really the universal aspect of this, we're considering the all with universal changing tables. And if we think about who we usually think about with changing tables, infants and toddlers, in 2020, it was estimated that 6% of the US population was under the age of 5. And really, that's the group that would be able to access the more traditional changing tables that we think of. In that same census, 26% of the US population, or 1 in 4 adults, had some type of disability. That includes mobility disabilities, cognitive disabilities, disabilities that impact their ability to live alone or need support with self-care tasks. So really, in moving towards universal changing tables, it would make public spaces accessible to everyone from infancy through adulthood, and really improve everyone's ability to participate meaningfully in the community. I thank you for your consideration of this bill, and I hope that it moves forward favorably. Thank you.
Thank you. Up next, we have Dr. Angela Lynn.
Hello, everyone. I just want to tell you how deeply moved I am by the chair, by the testimonies, by seeing democracy in Massachusetts in action. I'm here as a physician. I have the pleasure of caring for the child of Stacy Betts, and I'm a geneticist. I'm a medical geneticist physician at Mass General Hospital. And for over 30 years, I care for people with special physical needs, developmental disabilities, and autism. And importantly, what I'm trying to do is add something different to this incredible discussion, which is I care for children, but I also care all the way up through the age span to people who are in their 60s or 70s. And the point is, I think we're doing a pretty good job of taking care of special needs people, so there are more adults. And when Stacey asked me to do this, it was an easy ask because I'm a clean freak, because I had a toddler, 25 years ago. I could relate to everything that they were telling me. And what I wanted to add is this idea of the older person, which has been mentioned a couple times. I had a personal experience with my father who had the humiliating accident and needed to be carried off to a restroom. So I really get it. And I think that all of us do. Some of my comments are identical to the two gentlemen, the two congressmen who gave their own testimony to another bill. And it was really the same thing. I think all of us can understand this is not about urine and feces, as we call it. It's about pee and poop and the smell that goes along with it, and the avoidance of wanting to take care of kids and adults in an unsanitary manner. I hope this is okay. I'm more informal than some of the testifiers. Thank you.
Thank you for your testimony. Up next, we have Lisa Clues.
Good, how are you? I just got over. Hello, how are you? Can you hear me?
Yes, we can. Go right ahead.
Oh, perfect. Thank you so much for allowing me to provide my experience and support for H212. My name is Lisa Clues, and I have a daughter, Madison, now 23, who was born with a rare chromosomal disorder called Emmanuel syndrome. Madison was never expected to sit up or let alone walk or run in Special Olympics track, which she does today. She is nonverbal hearing impaired, but all of that does not stop her spirit. She loves music with all of her soul and really enjoys concerts and really all social functions. I'm advocating for the need for universal changing stations, a simple and required need for daily living function. Our families have been in challenging and embarrassing situations. Examples, one day at a hospital at Boston Children's, my husband recruited the woman running the little store at the hospital next to the bathroom to watch the door so that he could bring Maddie into the women's bathroom. Obviously a desperate situation for him to do that. What occurred is that she left the door because a patron came into the store, left him in there. A woman came in to the stall next to them. He tried to hide his feet so that he wouldn't scare the woman or put himself in a really awkward situation. When we have trips to Boston Children's, we make plans to stop at the Mass Pike so that we can take Madison into the family bathroom. Since they have a family restroom there, it makes it a little less embarrassing and challenging, but does not help with trying to manage keeping her off of the floor, her clothing, her bag, and all of that off of the unsanitary floor. At one of our son's hockey games, I was trying to change my daughter in the non-handicapped stall, wrestling in a small space, and I knocked her hearing aid off. And of course, it went flying and landed straight into the toilet. So there was $2,500 literally down the drain. Other tactics families do try is to carry a plastic tablecloth around, change the child on a table in front of everyone because there's no option, not even a handicapped stall. We would carry around an actual portable toilet seat to put on the toilets for Madison to sit on so she wouldn't fall in, and we could try to change her while sitting on the toilet. Our truck, as many others, has been a changing station for many years, not a pleasant sight or a situation parents should have to be put in. We have been questioned by people as the appearance at times, both in the car and in a stall. Are we attempting a kidnapping or another illegal act? Because it can get to that point. Another family changed their child next to a stage at the Oakdale Theater, their disabled child. I could go on and on with stories and frustrations, but our families need a safe and clean place to change our children and allow us to be able to go to public events and provide the best life for our children. Just thinking about having to panic and plan special routes or bring a toilet seat or a tablecloth with you the next time you go to run an errand or go to the doctor's, or if you're lucky enough to go to a social function. It exhausts many and ends up forcing families to stay home and at many times lead a lonely life. Please support Bill H212 so family and caretakers can provide care for their daily living function with dignity in a clean setting. Thank you.
Thank you, Lisa. Up next, we have Kathleen Amaral.
Can you hear me?
Yes.
Great. Dear Chair Kennedy and Livingstone and others on the committee still there, thank you for your time today and the opportunity to provide oral testimony. I'm speaking on behalf of the ARC of Massachusetts in support of House Bill 212, an act requiring universal changing stations in public buildings. You have heard such powerful testimony on this bill already, so I will just attempt to add to it for your consideration. We're familiar with infant changing tables, although we hear today there are elements of its own progress needed, but they make it possible for parents and caretakers to retreat to a restroom to change a baby or toddler while out enjoying time with friends and family. Sadly, in Massachusetts, public buildings and community spaces are not required to provide similar and complete equitable toileting accommodations for larger children or adults whose disabilities prevent them from accessing the current standard accessible restroom stall. As was noted earlier by Representative Garbely, Logan Airport has its own space for dogs to toilet, yet no space to accommodate the needs of older children and adults with disabilities. Unfortunately, this leads to isolation and results in many people with disabilities and medical complexities to avoid trips altogether due to lack of accommodation. As a mother to a young man who surpassed the weight limits of those infant stations, changing stations by the time he was 3, but whose disability precludes him from safely using a toilet still due to low muscle tone, our family often faces this dilemma, knowing it may require us to leave early or retreat to a parking garage to change a diaper in the back seat of a minivan, not the most dignified way to meet a basic human need. This bill seeks to provide a safe, private, and hygienic place to meet this most basic human toileting need of people with disabilities while away from home. And on the behalf of the ARC of Massachusetts, I ask that you please take action to pass House Bill 212 favorably soon out of committee. Thank you.
Thank you for your testimony. Appreciate it. Next up, we have Madeline Oden. No, not seeing here. Next, I'm going to go through a series of bills that we don't have anyone yet signed up to testify for. House 217, an act relative to income calculation of certain benefits. House 219, an act increasing collaboration amongst community organizations fighting hunger. House 221, an act preventing funds deposited in children's saving accounts from counting against cash assistance benefits. House 222 and Senate 100, an act establishing a special commission to study women in homelessness. House 223, an act establishing a special commission on two-generation approaches to childhood education. House 224, an act establishing an Office of Youth Development. House 225, an act relative to Department of Transitional Assistance benefits for diapers. And going back now, House 380 through 3870 and Senate 2434, an act establishing a designation of state protection and advocacy system. Do we have Beverly Goodrich here in person? No? Okay. Okay, virtually, we have Jennifer Honig.
Hi. Thank you. Chair Livingston, Chair Kennedy, and members of the committee. I'm Jennifer Honig, Co-Director of Public Policy and Government Relations for MAMH, the Mass Association for Mental Health. MAMH supports these bills. MAMH promotes mental health and well-being while preventing behavioral health conditions and associated disability. We have a long history of advocacy on behalf of individuals with disabilities in the community and in institutions in Massachusetts. And we've relied on the state's Protection and Advocacy Agency, now Disability Law Center, as an ally in that mission. Presently, we work together to divert individuals with psychiatric concerns from our overcrowded emergency rooms, which I know you've talked about today, encouraging instead reliance on a range of community-based alternatives. Together, we promote expansion of resources so that people can live independently in the community, ensuring their greater independence, as well as movement for all service recipients through our continuum of care. Together, we advocate for better conditions and services for Department of Mental Health clients. Together, we advocate for forensically involved people with serious mental health issues, particularly those currently held at Bridgewater State Hospital, a hospital in name only. Most importantly, together we have worked to protect individuals within the behavioral health system from abuse, injury, and even death. In this work, MAMH relies on the P&A agency as a key source of information regarding our service system, whether that be a DMH facility, a Department of Corrections facility like Bridgewater, a group home living environment, or a therapeutic special ed school. While we may have contacts with families or with individuals in such settings, we do not necessarily have access to the range of information, even basic information that would help us understand and promote improvements. And without such information, it's difficult to see the larger picture, whether one person's concern is a concern that affects many, and whether an action taken with respect to one person is based on a broader policy that impacts others. To improve the system of care and advocacy, we depend on the investigation, research, and analysis of our Protection and Advocacy Agency. However, we're also well aware that there are barriers to accessing even basic information that could help explain what someone is experiencing. While that information is not readily available, reform is put on hold and people could be placed at risk. We support this bill because it is carefully written to respond to such barriers. And I'll just quickly note the three types of information that this bill could help us have. Access to all locations. This was, Rick Glassman noted earlier that DLC was able to document Bridgewater's mold issue by going to the legislature. We've been advocating on Bridgewater, and it's essential for us to understand the physical plants there.
Thank you so much for your testimony. Thank you.
Thank you.
Next up, we have Thomas Brown.
Hi.
Hello.
Thank you, Chairs Kennedy and Livingston, for hearing my testimony, and committee members. I've testified over the past 12 years on many bills related to mental health, and this is the most important one that I have had the opportunity to testify on. I testifying very strongly in favor of an act establishing a designation of a state protection advocacy system, H3, H70, and S2434. I worked 14 years in a community mental health service agency, and also in a crisis stabilization unit run by a large Boston hospital and a community mental health services. Both received funding and licensing from the Department of Mental Health. The amount of abuse that I have witnessed while working in there is indescribable. I was a whistleblower within this agency, continually reporting on abuses that I saw. And I was consistently met with retaliation. I was never given a promotion. At one point, I was offered a promotion with a significant pay raise. I got the promotion without the pay raise because within that time, I had reported an incident of abuse. An example of abuse that I reported on, there was a person, a staff member in a group home who I felt was very dangerous. And I reported her behavior, and I was there was a investigation that was initiated and then shut down, and I was held responsible for the problems that were happening there. This is typical of what happens to people who report abuses in these agencies. These agencies are interested in keeping their names out of the newspapers, not protecting the people that they're paid to take care of. Later, 3 years later, this woman saw a woman within the group home fall down the stairs. And the woman crawled to her office and asked her to call an ambulance. And the staff person yelled at the woman to get back upstairs. The next morning, 7 hours later, she was found nearly dead from pneumonia from a broken rib that had punctured a lung. And this led her to be in the hospital for 4 months. None of that reached the newspapers. It never became public knowledge. And again, these are the type of things that happen over and over. An EMT recently reached out to me saying that he was continually asked to respond to a DMH licensed hospital that's typically in the news, frequently in the news, because they were calling him at a low crisis rate. I don't know the terminology, but that there's critical levels of care that can be responded to 1 to 3, and they were consistently called to respond with a lower rate of emergency for people who were in emergency situations, because they didn't want these reports of emergencies to be reported to the state, protecting themselves. And I have a lot more to say, and I'll put that in written testimony.
Thank you so much for that. Thank you. We have James Lamastro.
Yes, can you hear me?
Yes.
Thank you very much for having me. My name is James Lamastro. I am representing Dignity Alliance of Massachusetts. We're in full support of all provisions of this particular bill, but I would like to concentrate on one aspect of it, as well as submit written testimony on the whole of the bill. And part of this comes from my own experience in terms of being a person who's done surveying and accreditation of facility healthcare and rehabilitation facilities internationally. One of the central pillars of this effort is granting the designated P&A system the authority to inspect areas of facilities, all areas of facility, not solely those that are occupied by the persons with the disabilities. This authority is not just a formality. It's necessary to ensure that the comprehensive oversight and protection of individuals with disability. Without the authority to inspect areas outside the actual place where the person was reported with abuse, critical issues related to health and safety are not noticed or addressed. These issues might include unsanitary conditions, unsafe environments, code violations, and conditions which are contributing to the abuse and neglect, which might not be readily available in the place that the person is either receiving treatment or care. By extending the P&A system's oversight to encompass the entirety of the facility, the system can effectively eliminate blind spots and ensure that no area goes unexamined regarding the well-being of those with disability. When public health inspectors go in, and this applies to any public health inspector, whether they're in Massachusetts or in Ontario, where I've done a lot of work, they're able to look at the entire facility, not just the place that the person is at. They have access to not only the actual room, but the place in which the person receives its meals, the staff, and everything else like that. Without that full access, it could be difficult to be able to fully assess what's going on. This broad scope of authority sends a clear message that the safety and dignity of individual disabilities are non-negotiable, regardless of where the service is provided. It underscores the state's commitment to leaving no stone unturned in pursuing protection. Expanding the authority for the designated P&A system to inspect areas of facility not solely occupied by the person with disability is fundamental and vital step to a comprehensive oversight and protection. These extensions will, in the end, promote accountability, identify system problems, ensure transparency, promote continuous performance improvement, mitigate risk, and advocate for systemic reform. I want to thank you very much for allowing me to give this, and I will submit additional written testimony.
Thank you. I understand Beverly Goodrich, who has signed up in person, is actually online, so I'm going to invite Beverly to join us for testimony.
Hello?
Hi, Beverly, go right ahead.
Hi, can you hear me, see me?
We can, yes.
Yes, hi, thank you for allowing me to testify regarding House Bill S-2434 that will allow the Disability Law Center to be able to investigate people who have or have been inpatient at state facilities. I personally can relate to this issue. My brother Haywood Earl passed away August of 2020. He was inpatient at the Department of Mental Health facility, the Shattuck Hospital, for 3 years from 2017 to 2020. He passed away of a very treatable nose lesion on his nose. At the time of his passing, I had no idea of the extent of the treatment or medical treatment that he had gotten for that nose lesion. However, I sensed something was not correct, so I contacted Disability Law Center immediately after Haywood Earl passed away. They did extensive investigation, a 28-page investigation. Their findings concluded that my brother Haywood Earl had a lack of standard of care. It took the medical professionals at the state institution approximately 10 to 11 months to send him out to get a biopsy. If he had gotten that biopsy at an expedient amount of time, there's a strong possibility that my brother would be alive today. My brother Haywood Earl death is one example of many that may have occurred while they have been inpatient at state institutions. During that time, I did meet various people who were residents at the institutions, and actually they passed away before my brother passed away. They would come up to me and say, "Oh, you're Haywood's sister. I wish I had a sister that would come and visit me and help me out like you help your sister, help your brother, I'm sorry." So again, I strongly advocate for House Bill S-2434 to be passed by the Children's Family Committee. I believe that this bill will allow the Commonwealth of Massachusetts to be able to have more oversight for people who are inpatient at state facilities by allowing Disability Law Center to investigate the deaths. Thank you very much.
Thank you, and I'm sorry for the loss of your brother, but thank you for bringing his memory into the room here today with your testimony.
You're welcome.
Next, we have two bills that also don't have anyone signed up. House 3942, an act relative to supplemental nutrition assistance program countable income. Senate 98, an act concerning food insecurity and supporting the restaurant industry. Now we're going to move to Senate 105, an act relative to supporting families dealing with sudden unexplained death in pediatrics. And we have Senator Lovely joining us again. Good to see you again, Senator Lovely, and please go right ahead.
Thank you, Chair Kennedy and Chair Livingstone and members of the committee. Thank you. It is great to be back to speak on in support of Senate number 105, an act relative to supporting families dealing with sudden unexplained death in pediatrics. As we know, SIDS is the leading cause of death for infants 1 to 12 months old. Many families who experience a sudden unexpected death of their infant are left feeling devastated, isolated, and confused. The Commonwealth has tremendous resources for those who experience sudden and unexpected infant or child death, including the Massachusetts Center for Unexpected Infant and Child Death and Roberts Program at Boston Children's Hospital. However, many families have no knowledge of these helpful programs. I filed this legislation after meeting with a family in my district who tragically lost their son to SIDS. When Eric and Holly High left the hospital after learning of their son's death, they were sent home with no support and no resources. They felt lost and alone. While they were eventually able to find help, the Highs wanted to make sure that no other families will struggle the way they did. S-105 would ensure that the Office of the CME, the Chief Medical Examiner, would provide information on available support resources to families who have experienced sudden infant death. I hope that these resources will be available to families through the CME. We already know that DA Ryan has already instituted this through the DA's office in Middlesex County, and hoping that S-105, which is a refile, will get the committee's positive consideration. Eric High is with you today, who would like to also testify. I want to thank the committee's attention and would be happy to answer any questions. Thank you.
Thank you, Senator Lovely. We'll move then to in-person. Eric, welcome.
Thank you. I'm going to do my best to keep it together. So my name is Eric High. I'm here on behalf of my wife, Holly, our children, Eleanor, James, and Bourne, and our fellow SIDS families to speak. Sorry.
Take your time.
To speak on behalf of S-105. At its heart, S-105 is just asking you to rebuild a bridge that existed in the Commonwealth for 30 years. Before one appointed bureaucrat decided to bulldoze it unceremoniously. We're not asking for money. We're not asking for a new program. These programs exist. We already pay for them. DPH gives a block grant to the MCUICD to pay for them to help provide therapists and support to families, to connect families like mine with other families that have had these losses, which is honestly the only thing that helps. Unfortunately, there's no way for families to know that they exist as the system currently exists. Our son James was a perfectly happy and healthy 4-month-old. 8 years ago, in about 2 weeks, we got a phone call that no parent wants to get. James had been taken to the hospital after he was found lifeless in his crib. When we arrived, they were working on him, but he was gone. In the weeks that followed, we struggled. I'm so sorry.
Good job.
It's my 3rd time. You think it'd be better. We struggled to make sense of what happened. We heard nothing from any of the agencies that were investigating his death. We were simply a source of information to be asked questions, but not an actual partner in what was happening. Our kid was healthy and then he was dead, and nobody was helping us figure out why. We were given so little information, in fact, that we weren't even told when his autopsy was completed. I finally worked up the courage to call the OCME, and I was essentially told that his body had been ready for a day and he was waiting to be picked up. And why hadn't we called and scheduled someone to come pick him up? I didn't know that we were supposed to do that. The only way we did find help was we stumbled across, my wife was up at like 1 o'clock in the morning because you can't sleep after like 6 weeks. And we found a link to the MCUICD online. Unfortunately, because of the system that we have right now, access to their services is really dependent on your socioeconomic status, whether you have internet access. You can't find them unless you know where to look. They're much better at publicizing themselves than they were 8 years ago, but there's no reason why we can't refer families to them directly. It happened under the previous medical examiner for 30 years without issue. This was just kind of a stroke of the pen and a change to the system. I don't know if it's an oversight or exactly what happened, but we're left with kind of this patchwork system where essentially if you live in DA Ryan's district, you get referred automatically. If you live in anybody else's district, you don't. DA Tucker has been an amazing resource for us. Senator Lovely, we're so thankful for her and her team and their support in this. Representative Cruz is new to the team, but we're excited to kind of have him on board. And Lieutenant Governor Driscoll has been a big supporter of this for a couple of years now, and is trying to work on things on her side. But we really feel, Holly and I really feel like this needs to be legislative because it shouldn't depend on who sits in that office at the OCME. The legislature needs to tell the OCME, this is wrong, we can fix this, and you need to handle this. And so again, I don't, sorry. I want to thank you. I know ending your day with me is not the best way to do it. Our story is not an easy one to listen to, and I appreciate kind of your time, and I'm going to stop talking.
Thank you so much for being here and again, for bringing James's memory in the room. There are no words to explain your loss, and I'm so incredibly sorry. And thank you for sharing that to be able to raise this issue. And this is why we're here. So thank you. And thank you for your testimony.
Thank you.
And I just want to add, I really appreciate your patience, staying here all day and sharing this incredible, difficult story. As a father myself, I can't imagine getting that phone call or what you've been through. And I'm just very sorry. We'll see what we can do.
Thank you. Thank you.
Thank you. We also have Alexander Friedman to testify on this bill.
Yes, Chair Livingstone, Chair Kennedy, and members of the Joint Committee on Children, Families, and Persons with Disabilities. Thank you for the opportunity to testify today in support of S-105, an act relative to supporting families dealing with sudden unexplained death in pediatrics. This bill would require the Office of the Chief Medical Examiner to provide much needed linkages between bereaved families and critical services and supports via the Massachusetts Center for Unexpected Infant and Child Death, which I represent here today. My name is Alexander Friedman, and I am the program manager of the Mass Center, a position I have been privileged to hold since 2015. The MA Center has been in operation since 1975, housed at Boston Medical Center to provide statewide bereavement support to any family whose infant or young child has died suddenly or unexpectedly. These services are at absolutely no cost to the family, nor billed through insurance due to the generous, decades-long grant funding and state contract we receive from the Massachusetts Department of Public Health. We serve all families regardless of any demographic factor, including language spoken or immigration status, thanks to the extensive network of resources available at Boston Medical Center. The sudden death of a child is one of the most devastating and life-altering tragedies that can befall any family. It is a parent's absolute worst nightmare and beyond comprehension. How do you lose a child one day and wake up the next day yourself? How do you explain to your 6-year-old that the baby brother he welcomed home and held in his arms will no longer be there? How does the world make any sense anymore? Our center has served hundreds upon hundreds of families, and I will tell you that each and every story can bring you to your knees. No parent should have to go through this alone. Each year, roughly 3,500 families in the United States suffer this unimaginable event. Sudden unexpected infant death and sudden infant death syndrome remain the leading causes of death for infants under the age of 1 in both the United States and Massachusetts. And while there is much we still do not know about what causes these deaths, what we do know for certain is that programs such as ours can be the life raft for families throughout their darkest of times. The Office of the Chief Medical Examiner is the single entity that interfaces with all caregivers whose children die in the Commonwealth. Many states in our nation have laws related to SIDS and SUD, inclusive of specialized training for first responders, guidance for chief medical examiners and coroners, and the provision of critical linkages to counseling programs such as ours, and is importantly prescribed in this bill. We know that connections matter, information matters, not being lost in the cracks of a system that could have been properly set up for support rather than exacerbated isolation and excruciating pain also matters. Thank you again for the opportunity to speak today in favor of S-105. I urge the committee to report this bill favorably as soon as possible.
Thank you so much for your testimony and for the work that you do. I imagine it is very difficult. So thank you. Thank you for that. Okay, we have moving forward with 2 bills where we don't have anybody else signed up to testify. That's Senate 127, an act relative to establishing an emergency food assistance committee, and Senate 128, resolve establishing a commission to study childhood hunger in Norfolk County as a result of the COVID-19 pandemic. We have 2 individuals who have signed up to testify. One is Georgia Barlow to testify on behalf of House 150, Senate 85. Thank you, and thank you for your patience.
Hi, good afternoon. My name is Georgia Barlow. I'm on the Government Affairs team at the Metropolitan Area Planning Council, and I'm here to express our support for Senate Bill 85 and House Bill 150 to make permanent the healthy incentives programs. MAPC is the regional planning agency for the 101 cities and towns in Greater Boston. We support municipal and community partners to plan for a range of issues, including housing, transportation, land use, economic development, and public health. Our public health team leads efforts to advance community health and health equity with partners, including our efforts to increase healthy and equitable food access throughout the Commonwealth. We've been long supporters of the healthy incentives programs, and we support this legislation to codify it permanently into statute. Food insecurity and limited healthy food access are complicated issues with no simple fix. We know that rates of food insecurity in the Commonwealth have only risen since the pandemic, and we're going to need a variety of tools to fully address this challenge. We're excited about this program in particular because not only does it increase food access for people using the SNAP benefits, but it also provides economic security for farmers and providers throughout the Commonwealth while building a complete food system. Since its inception, over 250,000 SNAP recipients have utilized this program when they purchase products from farmers markets, farm stands, CSA farm share programs, and others, supporting over $52 million in produce sales for the local farmers throughout the Commonwealth. People utilizing SNAP and HIP benefits have limited food purchasing power. Fresh local produce can be expensive, particularly when farmers charge fair prices that cover the true costs of their production. HIP benefits enable participants to purchase this healthy food, connect with local farmers, and support our local food system. We thank the legislature for continued support for this program in the state budget and ask that you report these bills favorably to ensure that it's a permanent program in Massachusetts. We are also going to be submitting written testimony, and thank you all for being here today.
Excellent. Thank you for your testimony and again for your patience. We have Sierra Derns. No longer here. Okay. I'm going to go back through to individuals that had signed up earlier that maybe missed their first go around. And first we have Casey Burns testifying on behalf of, looks like several bills, but House 135 and Senate 76. Welcome, Casey.
Thank you so much for having me, and thank you for rearranging the schedule to allow me to speak. Really appreciate it. My name is Casey Burns. I live and work in Worcester, Massachusetts, but I do work regionally on behalf of Central Massachusetts. I work with two kind of significant community coalitions: the Coalition for Health for Greater Worcester, which is broad health equity work, and we work in partnership with some of our institutions on the Community Health Improvement Plan. And then I also work as the co-chair of the Center on Food Equity with the Worcester County Food Bank, which houses the Worcester Food Policy Council and the Task Force Food Security, as well as the Central Mass SNAP Coalition. And I would just want to highlight the kind of breadth of our partnerships that we have involved throughout the year, advocating on emergency food coordination, whether it be hot meals in the pandemics, food pantry deliveries, and that work on the ground informs what our policy priorities are. Our understanding of what the challenges are that our communities face in Central Massachusetts and beyond inform what we then as a coalition advocate for. And what we have seen as such significant barriers really led to the support for both House 178, Senate 117, and Act to Protect the Safety Net Access for Massachusetts residents, because we saw the impact when the DTA office moved from Central Worcester out to Route 20. It took our community members 4 hours to go to the in-person office if they were using public transportation. They then had to walk on uneven sidewalks. They then had to, when they came in, were often told to go see a kiosk or go home and use an online service when they didn't have the accessibility to be able to do that. It makes a significant asset to have meaningful opportunities to engage with in-person support. And that's what this bill would do, would require a community engagement process before closing or relocating an office to really determine the impact that's going to have on our community members. And so the second piece is House 135, Senate 76, an act establishing basic needs assistance for Massachusetts immigrant residents. And that, as I'm sure you've heard, expands access to SNAP and TANF benefits for legally present immigrants who are excluded from federal benefits because of time limits or waiting periods or other restrictions. We feel an incredible stress, especially in our immigrant communities, in this critical period of the first years they're in the country, the first period, and them not being able to access these incredibly important safety net benefits to get basic needs met, like food, is incredibly harmful, and we see it impact throughout their experience. And so I just want to thank you for your time and appreciation, and really hope that you will favorably consider both of these pieces of legislation.
Thank you, Casey. Thank you for all you do for the Worcester community and our surrounding communities. So thank you. Okay, we had Palma McLaughlin. Ken Rago. L. Riley. Steve Walsh. Judith Ursity. Cheryl Smaltz. Amy Mitchell. Madeline Oden. I think that's everybody. Is there anyone online who hasn't had the opportunity to testify yet that would like to do so? Excellent. With that, does he have any closing comments?
Great job carrying the committee today.
Same to you. Thank you so much. And with that, we will adjourn.